I think we can go to our
Right.
in-person Zoom comments first.
Would you like me to promote one of them to the
Oh,
floor?
yes, please. I'm sorry.
Okay.
Yeah, just in
No
no
worries.
particular order. I see on my screen Diane Loricella and then Dewan Wiggins. Thank you.
Hello, Diane, can you hear us?
Yeah. Yes, thank you. Good evening, everyone, and Madam Chairwoman. My name is Diane Loricella. I know that the minutes are not verbatim, but in the recent past, I have been surprised that when I've spoken, that some very important items are left out. So I ask that I didn't have time to write this to you in advance, but there be a correction to the minutes in the following, and they're brief ones. My address is 21 Blue Mountain Ridge Road. There is a 21 Blue Mountain Road, but it is not my location. So please add the word ridge after mountain. Also, I stated that at the sentence, and it's not K9 masks, it's KN as in Nancy, 95 masks are, and then, so please insert the word KN95 before the word mask, and then please insert the following that I did say. I did not say that the KN95 masks are the safest option. I said they are a safe option. So please replace the word safest with the word safe. The reason I think it's important that these be placed is because I have professional background in masks, and I don't want, since this is a record, anyone to think that I don't know what I'm speaking about. So lastly, Madam Chairwoman, I would like a meeting with either the Lamond and the chairwoman or the director of the health department or any of their choosing. I asked a question last month about what other things is our city doing to inform people about the toolbox they can use besides vaccines and boosters in order to remain safe if they choose. I do not think this city should rely on the CDC confusing messaging that has proliferated ever since Trump and even with Biden. I am a news hound. I have not seen any easily accessible information about the efficacy of masks and distancing and ventilation. The word ventilation is important for the public in layman's terms to understand, because that will help not eliminate, but reduce the chance for COVID in BA.2 or any future COVID. And it is very frustrating for me as a longtime citizen that shares her expertise with her city to feel like they are being ignored. I know it is not meant by you, Madam Chairwoman, but this is not a new topic with me. And since no one had called me for the entire month or the last 2.5 years, and I still do not feel the city is messaging about COVID and masking and ventilation and other tools well enough. You're going to hear from Mr. Weeks and Teresa.
Thank you, Ms. Loricella, about 10 seconds left. So
Thank you. I will close.
thank you. Oh, very
They
good.
will tell you that they are doing this and that and the mayor on every other Friday. That is not enough. They are very wise and smart. There are many ways to get messages out, including having our council members have special events with their own constituents and using
Okay.
social media more effectively.
Thank you.
Thank
Thanks, Ms. Loricella. Appreciate that very much.
Thank you.
All right. I believe I see Dewan Wiggins next. Mr. Wiggins can be admitted as a panelist, please. Thank you.
Hello, everyone. As she said, my name is Dewan Wiggins. And if you know me, you know I'm very passionate about the work that I do, serving underprivileged youth in Norwalk, and particularly South Norwalk, right? Because we know that's where most of the youth are, right? That's underprivileged. So I have some comments I want to say, and hopefully some questions that I can have answers about the ARPA funding that will be released tonight, right? The organizations that will be picked tonight, right? I want to, for the record, I really want to know the process in which that is happening, because from my understanding, it's people from the city that's hired, city employees that's in charge of just picking the organizations that they feel that should be receiving the funds. If I'm not mistaken, y'all can correct me if I'm wrong. It would be Lamont Daniels, Darlene Young, David, and I don't know who else is in that process. But for me, I think the community should be involved in that process since the funding is for the community. Also, I want to highlight the ARPA money is for communities that's affected by COVID. And we know that most communities, right, that's affected by COVID typically are the Black and brown communities. And as we know, in Norwalk, majority of South Norwalk are Black and brown, right? And it's just, I also wanted to note that it's been a lot of talk around, why certain organizations, even though we don't know what organizations are getting it yet. I wish this was afterwards, but us being denied, meaning the collaborative. So it was said to us, in the beginning that organizations should be working together, right? They told us, we was on a call with a bunch of different organizations, and they said that we should work together as a collaborative. A group of us got together as a collaborative in South Norwalk. Most of our organizations is ran in South Norwalk, about a large chunk of them. We got together and we built a collaborative. And then it was said that, our budget was too high, which we applied for like about 400,000, and they came back and said it was way too high. We should apply for, cut it in half. So we cut it to 180,000 so we could serve our community. I want to be note, right? We're looking to serve 70 to 100 students in a year, and 180,000 for, the community for 4 organizations is really nothing. We can do nothing, but we can work with what we have, right? So the reason why I'm putting light on this, because typically people in South Norwalk, Black and brown people in these communities has been shunned and has not got their fair share. And it's just, we're going to just call it what it is. And it happens over and over, and people are literally scared to talk about this stuff. And it's sickening and it's tired, and we really need to start bringing this to the attention of the council, the people, members. Like, you're going to see members, I don't know if you can see.
I'm going to give you a 10-second. Thank you so much.
Okay. You're going to see members that's typically not here. I organized probably over 20 people that's on this call that's typically not here. And I just want, the common council to ask questions. I want not just to vote, ask questions of what's happening, what's going on. And I'm a representative of these people, these young Black and brown people of South Norwalk that's typically overlooked. So I'm going to leave it there, but I pray we have some more time to talk about these things.
Thank you very much, Mr. Wiggins. Appreciate that. I see a lot of attendees, but I'm not sure if you all would like to speak. So if you'd like to speak, please raise your hand on Zoom, or I forgot if it's is it *6? I forget what it is to unmute yourself. My apologies. 2 years.
Do it for him. We have one more.
Oh, wonderful. Oh, great. Thank you. Oh, I see. Michelle Hobson. Yes, please. Be given panelists. Thank you. Thank you, Ms. Hobson.
Hi, everybody. I just wanted to kind of echo what Dewan Wiggins was talking about. I believe he's trying to represent an underserved community that he and a lot of his collaborative work tirelessly and every day to represent them. So I just hope when the discussions come, it sounds like what the collaborative is talking about is they want transparency, they want advocacy, they want a fair share. They want access to what they need to do to make it work to serve these students. We know everything that we're saying right now, you all have said to yourselves and are trying to find the solutions for our Black, brown, yellow, communities. We live in Fairfield County where we have the highest inequality, and we know that those who are affected by it, and especially in COVID, are the most underserved and poorest communities that Dewan is serving right now. So I'm just echoing his passion because I feel like it's important for everyone to remember that it just takes that one student, one family to come up, right? Like we know those who are in the inequality scale, if you're in the poverty zone, you have a higher likely chance for criminal activities to be part of the social status. And what he's trying to do and the collaborative and what they're trying to do is get the families and the kids out of that system and working and processing in a community development way so that they are sustainable and can have jobs and understand how to navigate this kind of world that we are. So I just, what we're trying to do is trying to shed some light on the needs of the underserved in the Sono population for the students and the families who are poor and underserved. So thank you for letting us speak. And if you can kindly continue to advocate and remember that there's a lot of people who work and volunteer for this population, they do it without pay because it's their community and their people. So thank you.
Thank you, Ms. Hobson, very much. Appreciate it. Anyone else on Zoom would like to speak? Please raise your Zoom hand. It's one more call, I guess, last call. Anyone on Zoom would like to speak? Please just raise your Zoom hand.
Not seeing anyone.
I see.
Oh, I got one more.
Oh, yes, thank you. Tristan Fields. Mr. Fields, thank you.
Hi, good evening. My question is on the similar vein as the previous two speakers, but much shorter. I'm just interested in hearing the council's thoughts and plans in the future. I've been in Norwalk for about 11 years, and I've seen the YMCA close. I've seen the South Norwalk Community Center kind of shut down or close to shut down. And I've seen a mall go up, and I see a Wegmans coming in. And so I'm interested in hearing the council's direction and discussion around, what message that's sending to our students and our youth, and how are we counteracting those places? Because when I talk to the kids, they feel like Norwalk does not invest in them. And it impacts how they perform in school and how they perform, just are motivated to work outside. So I'm interested to hear what are we doing to counteract those things? Because from somebody, like I said, I haven't lived here all my life, but just in the past 10 years, the amount of things that I've seen services taken away, I haven't necessarily seen replaced. And the investment in certain areas have not been the same as the investment in business or on contacting firms to make plans and the thousands of dollars that has been put in those things have not been matched in the amount of money that's been put in services. So that's just one of the things that I'll be interested in hearing more about, similar to the other speakers' questions. And cede my time.
Thank you. Thank you, Mr. Fields. I appreciate it very much. Anyone else on Zoom like to make public comment? Just raise the Zoom hand, please.
Is that okay?
I see one more. Oh, yes. Sarah Johnson. Ms. Johnson?
Yes, thank you. Can you hear me? Yes.
Yes, we can.
Okay, thank you. I would like to echo only in the sense of transparency the comments that have been made already My comments are not related to these ARPA funds, but they are related to having questions asked and not answered previously, and having a concern that the equity and justice for all remains a part of the agenda on this committee's meetings. It is not present tonight, and I remain concerned about that. I have sent a note. I apologize for its tardiness. It did not get to you in time to be included in the agenda. I hope that it will be able to come to light and be helpful to the committee. I just want to say again, I remain concerned about two things. One is transparency and having questions answered that have been asked in the public record. And the other one is to have the Equity and Justice for All initiative continue to be present as an agenda item until there is action taken. That is all. Thank you very much.
Thank you very much, Ms. Johnson. I appreciate that. I also see another hand up. Genesis or Genesis? My apologies, Brito.
Hi, it's Genesis.
Genesis, thank you.
Yeah, can you hear me?
Yes, we can, Ms. Brito, the floor is yours. Thank you.
Okay, hi, I just, really quickly, I just wanted to say I agree. I think it was Christian was his name, the last man that spoke before the last woman. I just agree with everything he said. And I kind of witnessed it myself because I was a college student. I was living in Norwalk in housing, and it kind of happened to me. Like I had to like move out of housing because I was, with my grandmother, and then it so pretty much like I felt like I got kicked out of out of Norwalk too. So I had to move into Bridgeport, and that happens to like a lot of us because we don't feel like we either have the support or the resources, and we just have to go, where it's like cheaper. But yeah, we just need to like where are these funds going, and what communities it serves, because it's just, I don't know. I agree with Christian. I just wanted to say that.
Oh, thank you, Ms. Brito. You still have time. Would you like to cede the floor? Are you good?
Yeah.
Oh, very good. Thank you very much, Genesis, for your comments. I appreciate it. I'll get my timer going again. I do see another hand or two, I believe. First, yes, it's Adriana Lewis, I believe.
Hello, my name is
Hello,
Adriana
Ms. Lewis.
Lewis. Hello, I'm a high school student. I work for the community. I volunteer. I do a lot of things within the community. And I really want to see, what is Common Council actually doing with the funds? What do they do with their jobs? They sit around and vote and do literally nothing that doesn't serve the kids. Everybody wants to know why today's students aren't being as progressive and being more focused. Is because they think the people that's serving them in office is giving up on them. And I personally have seen it firsthand. I've worked with Diana, I work with Dewan, I work with a lot of people that are in these high power places, but there's no changes that have seen to help kids being pushed forward. I'm going to college, and I have not seen Norwalk really push kids to help them, like, oh, where do you see yourself in 5 years? There's no programs out there. There's only the Carver. There need to be other sources besides the Carver. You can't just send everybody to one space so they can be progressive and be better themselves in a sense. I feel like we need funding at all these small organizations to help kids to progress, to make them better, to feel wanted. Because right now they don't feel wanted. They don't feel like anything. They just want to hang out with their friends and not go to school not want to be a part of changing Norwalk. So I think this meeting needs to be geared to what the students and what the kids of Connecticut need, or Norwalk needs. And I'm done. Thank you.
Thank you very much, Ms. Lewis. Appreciate that. Other folks on the Zoom have a comment, public comment to make? Please raise your hand now on Zoom.
Ridiculous. We need money too.
I see one person. Yes, there it is. Mr. Jalen Seed. You can promote Mr. Seed to the, there he is.
Hi, my name is Jalen Seed. I hope you guys are doing great today. Community member and elected official. Just wanted to just come on and really highlight the need from these cries that people just need to be heard. And there continues to be a disconnect between the good intentions of City Hall and the people that need help in South Norwalk and the lower income minority communities around the city. I know that we started the Equality and Justice for All commission, and I know that kind of fell through the cracks, but these people need to be heard, and there's cries for funding, and really there's just cries for them to be heard. So really hope that we can take a look at some action plans to really bridge that gap between the people who are historically listened to. And we have people that's doing the work like Tristan Fields and Dewan and Diana Revelos, Councilwoman Diana Revelos, and Councilwoman. It's a lot of people that's doing the work, but we just have to bridge these gaps so that these people are heard and these needs are felt, or we're just going to continue to lose these people to cities like Bridgeport and Sonia. And it's really a travesty because Norwalk is constantly toting how much they love the diversity, not just in cultures, but also in socioeconomics. And we really need to help build those up. So that's all I wanted to say, that I hope that we're really listening to these people and bridge these gaps between what's going on in City Hall and what's really going on in the community. Thanks.
Thank you, Mr. Seed, very much. Anyone else on Zoom would like to speak? Please raise your Zoom hand. All right, I see. Oh, that's Jalen. Okay, anyone else? I guess this would be a last call. Last call for public comment on Zoom. Just please raise the hand feature on Zoom. Use that one. All right, last call, seeing and hearing none. Okay, I will thank you all so much for your public comment. We'll move to written public comment now. And I believe Ms. Sarah Johnson, who gave public comment tonight, also wrote in and referred to that. So I believe that could be entered potentially into the record. Mr. Lamont Daniels, Chief Daniels, and I both received that email. Mr. Daniels, have you received any other correspondence from community members today?
Good evening.
Good evening.
The email that I received is from Watkins. Is that the one you would like me to read tonight?
Oh yes, please. That I did receive as well. That is the second of the two. Thank you, and good evening as well, Mr.
That's okay.
Right in there. Yes, please. Thank you.
For the record, my office received an email stated today at 1:41 p.m. The sender is RNSJ Coalition. The email is race@socialjusticecoalition@gmail.com. Dear Chairwoman Johnson and Chief Daniels, I would like to call to your attention. Give me one moment. I would like to call to your attention to some corrections to the Community Services Committee minutes for March 16, 2022. Both Ms. Gail Bentley Taylor and I made public comments at the beginning of that meeting. 3 others' comments, in quotes, Ms. Virginia Balser, Miss Susan Cole, and Miss Sarah Johnson, close parentheses, were received by mail and read into the record of that meeting. In each instance, the group from which we identified ourselves, with was erroneously reported in the minutes. Each of us are members of the Race and Social Justice Coalition, and I ask that the March minutes be corrected to reflect that name for greater clarity and accuracy. Additionally, my comments regarding support for a diversity, equity, and inclusion officer were somewhat mischaracterized. The minutes states, quote, "She endorses an appointment of a well-qualified officer for the city to be hired under clear priorities to address and regulate hiring practices," close quote. While this is all true, my remarks were not limited to the regulation of city hiring practices. There are any number of areas in the city structure that diversity, equity, and inclusion must be addressed. Hiring practices was but one example, as I indicated that our city employees are far from representative of the demographics of our population. I ask that this correction also be made. I would also like to note the absence of this topic on tonight's agenda and express my hope that it will be taken up once again next month and in the subsequent months until resolution of the issue is made. Many thanks, Ann M. Watkins, 12 Kreiner Lane, 06850, Norwalk resident, District D, member of the Race and Social Justice Coalition. Thank you, Madam Chair.
Thank you, Chief Daniels. You had 9 seconds to spare. That was very good. All right. I believe that's it for correspondence I received. Is that all for the correspondence you received, Chief Daniels?
Yes.
Oh, very good. Any of the committee members received any correspondence from community members in advance of this evening's meeting? Oh, Councilwoman Revolus.
I would just say a lot of this that has been sent to me directly. I am very proud of people speaking up for South Norwalk. I am in total agreement. I also am very proud of one of my kids, my mentees who just spoke, Adriana. I'm very proud of you. You're doing a great job and graduating soon. The realities of what we do for our community and how we speak even within equity. What doesn't come to them needs to be seen, and them not being heard is obviously being felt because of all week, since Monday, this is all I've been hearing, and of great disregard of those who are trying to make a change on the community floor, on a grassroots level, and for the feeling of bias and overall just overlooking dismay that they feel of our city and the city and people who work for the city that are sitting right here and are being talked to right now. So I just want to commend anyone and everyone who comes up and speaks up to our council at any point, at any time, do it more. For our common council people that are here, we work diligently to try to serve you guys. And I definitely appreciate any voice that speaks up for District B.
Thank you, Councilwoman Rivolu. I see Councilmember Keegan.
Yeah, thank you, Madam Chair. Just, I may be a little out of line on this, but I would like to talk just for a few minutes about what we all just heard from the 7 speakers. Ms. Hobson to Ms. Lewis, Mr. Seed, and Mr. Wiggins. I hear what they are saying, and Diana, I understand how proud you are that they are speaking up, and I just want my colleagues to know that I hear what they're saying. It almost feels to me as if it's a cry for help, that they're asking for our help in helping them kind of navigate the system so that they can get the proper funding for the programs that they're most proud of, that they are, you know, trying to instill into the city, especially in District B, which I think is totally underserved by our community. I have always believed that. But anyway, I just want those speakers to know that I heard every word you said. And I hope that we can all work together as a committee to accomplish whatever it needs to be accomplished to bring what you want for your city to fruition. And thank you very much for speaking up. I appreciate it. Thank you.
Thank you, Councilmember Keegan. Any other member of the committee receive any correspondence from community members? Seeing none. All right, so I'll close public comment for this meeting. And that doesn't mean we, as council members, won't address and be able to take what we've just heard into consideration as we talk tonight. I think some of the things that were raised certainly are on our minds and will come through in the conversation as we progress. And I want to thank everybody who came out to comment and who sent the emails. We really appreciate it. Like my colleague said, like anytime you show up like that, it's an amazing thing. So thank you. I would like to then ask for a motion to approve the minutes from our meeting held on March 16. I saw Councilwoman Revolu is giving us the motion. All right. So thank you so much. Any additions, corrections, deletions? As you all probably can guess, I have some, but I'll defer to you all first, especially with regard to individual council members to just verify that what has been represented, what you said as represented, if that's sufficient for you or not, if we should change it. So please just let me know. Any additions, corrections? Everyone all right with what they said is written? Okay. Well, then I'll jump in. In addition to, I believe, for our Telesco this evening, we did have some corrections submitted about, and I assume that will be reflected in the minutes next time, about Blue Mountain Ridge Road, KN95, not K9, and the word safe. I also have some corrections on page 4. I believe that Mr. Delgado was here under the auspices of working on the community food report, so his affiliation on page 4 is incorrect. I believe it should be, I'm trying to go to page 4 now. Let's see, I believe it should be something to the effect of, I mean, he's not affiliated with the city of Norwalk, so it's discussed how he's affiliated with Bridgeport, so we may want to add that in there. Under B, Mr. Delgado, Economic Development Director, City of Bridgeport. I also have a change on the top of page 5. Councilwoman Nicole Ayers' last name is misspelled. It should be Ayers. On page 5, I also have a misspelling, Ms. Estrella's name. It should be Anna Vivian. And on the top of page 6, ARRP should be ARPA. And lastly, on page 7, where I am being, well, paraphrased, it's instead of it saying compliance, I believe that should be something to the effect of addressing the work to be done by the ordinance committee on developing an ordinance with this initiative at the next meeting. I think that's more of what I was getting at. Any other changes, additions, corrections? Last call for that. All right, so all in favor of approving the minutes as amended, please raise your hand for approval, if you so desire. Any abstentions? Or I should say any no's before that. No. Okay, so it looked unanimous. We have that. We have approval of the minutes. Thank you all so much. Moving on, we have discussion items this evening, and I've been, I believe that we have, and Mr. Lamont, Mr. Daniels, I'm going to run this by you. we have at least one council member who will need to recuse themselves. Is it possible to move some of the voted items under Health Department up earlier in the evening, or is that dependent on a presentation?
Yes, my understanding is the ARPA component at the end.
Okay.
It's
And
not.
So
So
for that
most
will be
certainly,
before that. Okay.
okay, most certainly we can move that to the end. Absolutely. Thank you.
Okay, that sounds great. For that just to be seamless, I appreciate that. So
Absolutely.
we'll start tonight with our Health Department. I did hear from some folks in my inbox as well. While not explicitly on the agenda, we will have a check-in about where we are, if there's any news to report about the Equity Justice for All once we get to 4C. So we'll start with our wonderful Health Department 4A. With us tonight is Teresa Argandesi, our Assistant Health Director. Thank you for joining us again after that great presentation on nutrition. I also see our epidemiologist, Brian Weeks. I'll pass it off to you, Mr. Daniels, for our discussion. Oh, got you on mute.
I did it. I always try to avoid not to do that. Thank you so much, Madam Chair, and good evening, council members of the Community Services Committee. Well, I just want to quickly say our leader, our Director of Health, Deanna Diamore, is on a well-due vacation. But we are in most certainly good hands with our Assistant Director, Teresa Argandesi, Assistant Director of Health. So she will be presenting on all things COVID. And of course, the amazing Brian Weeks, our epidemiologist, will share. So I'm gonna yield the floor to Ms. Argandesi, our Assistant Health Director, and they'll lead this portion of discussion specific to what's on tonight's agenda. Good evening, Teresa.
Good evening. Thank you so much for inviting us again to give you a quick update. I will toss it to Brian in just a second, but just to give you an overview, we continue to monitor all things COVID and learn, as a community, how to navigate this latest phase of the pandemic. The health department continues to encourage precautions whenever appropriate. For COVID-19, we have, in addition to presentations at community meetings and our online communications, both on our website and our social media, we do have a team of community health workers, both at the health department and at our partner agency, Family and Children's Agency, who are out in the community in person, having conversations, handing out information, answering questions, and connecting people to resources. They are promoting messaging around masking, the symptoms of COVID, testing early and often, vaccination, boosters, and a lot of the COVID precaution measures that we've been talking about for quite some time. Some news as of recently, you may have noticed the testing site, our large community testing site, has moved recently from Shady Beach over to the Lockwood Matthews Mansion lower parking lot. So Quest Diagnostics, in cooperation with the city and state health officials, are continuing to operate that site. It operates on Monday, Tuesday, Thursday from 2 to 5 p.m. and on Saturdays from 10 to 2. And the state as a whole is monitoring the COVID numbers and preparing for changes to capacity for testing based on increased case counts and or decreased case counts, as the case may be. In addition, we're really encouraging people to test both at those community sites and also at home if they're feeling symptomatic. We have 2 websites of interest or pages on our website. One provides some general information and tips for testing at home, because we know at-home test kits are much more available now. And people are utilizing them often. And so some information on how to use your test and what to do when you get results. And then we also have a self-report portal. So it's a website where folks can go if they take an at-home test and it comes back positive, they can submit their positive results to the health department, because at-home tests don't get reported to us normally the way PCR tests do. So folks can go there, input their information, they get redirected to a page with some guidance on what to do if you've tested positive and how to protect yourself and your family. And then they also may be able to get a call from the health department, depending on, what our case counts are that day or that week, to get some additional information, answer questions. So then also on the testing front, there is such a thing as a test to treat locator. I don't know if you've heard of that in the news, but the federal program operated through the state is called Test to Treat. And the purpose is for someone to be able to go to specific locations, get a COVID test, and if they test positive, be able to be evaluated and possibly prescribed antiviral medication or other medications available to help reduce the risk of severe COVID or hospitalization if they're eligible. And so right now there is one location in Norwalk and a couple other is in other towns nearby, but there's a website where you can go plug in your zip code and find that information. Otherwise, we do encourage people, if they test positive, to contact their healthcare provider to find out if they are eligible for treatment, because there are more treatments available now, and they can assist with reducing the severity of your disease if you're somebody at high risk. So those are some of the major news points, but at this point, I guess I'll ask Brian to give us an overview of the data and where we are in terms of overall pandemic situation. Brian?
All right, yeah, thank you, Teresa. Thank you, everybody. Good evening. So let me just pull up the PowerPoint and we'll jump right into it. So what you should see as the first slide is just a reminder that this data is updated in the afternoon of today, April 20th. And so kind of jumping right into it, on the right-hand side here, we'll talk about this first. This is the CDC community levels by county. And as you can see, green is good, right? That's the low level. Then it's a three-tiered system, it has the medium, which is yellow, and high, which is orange. Obviously, we don't want to be in the high, or obviously that would kind of relate to other kind of preventive measures in communication. But nonetheless, as you can see, majority of the country is still in the low per this framework that the CDC has developed, 94.14% of the country, although we still have about 5.43% of the country that's in medium and 0.43% that's in the high. And one thing I wanted to note is, in terms of that high categorization, that is mostly New York. So I just wanted to mention that because especially that's, our neighbor. And so that also kind of plays into, some other information I'll be providing later. But nonetheless, when we switch over to Connecticut, for the 8 Connecticut counties, Fairfield County is fortunately still in the low, but New London County has moved into the medium. The hope is that it might jump back into the green when the News Thursday report comes out from the CDC in regards to this measure, but it's just important to kind of keep note of this. The important thing about this measure, because it differs from that 4-tiered system we saw before, which had the red, yellow, orange, and blue, this is more based upon hospital capacity and utilization. And it's, again, just to adjust accordingly if obviously the healthcare system becomes overwhelmed, and accordingly adjusting. So on the left-hand side here, you see the usual kind of Johns Hopkins Coronavirus Resource Center data. So just to quickly go over the kind of the global stats, as well as specifically for the country, we have about 506 million plus global confirmed cases, 6.2 million plus global deaths. U.S. confirmed cases about 80.8 million. And then U.S. deaths, pretty close to 990,000. And so we keep creeping closer and closer to the 1 million U.S. confirmed COVID deaths throughout the entirety of the pandemic. So just to take note of that. So moving to the next slide, again, just explaining this for anybody who's new to this system from the CDC, what exactly it means. So for the green levels, and the baseline for all these levels is having a plan and obviously capacity for rapid testing, obviously coordinating with your healthcare provider for any sort of healthcare treatment, especially for the test to treat, and being able to do oral antivirals in regards to SARS-CoV-2, the virus that causes COVID-19. Now for the medium level, as well as for the high levels, recommendations to wear a mask or a respirator, just in certain settings, but also being very mindful of that, because that means activity is obviously increasing, and hospital utilization and healthcare utilization is increased. Then for high, the orange, it's also considering avoiding non-essential indoor activities in public where you could be exposed. So that's kind of just the general considerations tied to that framework. So I think this is a very important slide, just because this is in regards to the SARS-CoV-2 variant surveillance. This is, again, the virus that causes COVID-19. And so if we look at the kind of the very colorful chart on the left-hand side, you see the deep purple or the dark purple and the lighter purple that is basically the initial strains of Omicron that we've been dealing with, since the beginning of January. And then, as you can see, what we're familiar with, especially in the news, is BA2, which is here in the pink, and how it slowly increased its presence. We were kind of seeing that for some time over the weeks, but then it rapidly grew. Bear in mind, it had about 30% increased transmissibility compared to the prior strains of Omicron that we've been dealing with in the earlier part of the year. Now, the thing I want to mention, because the news is just starting to really run with this, and the CDC's recently provided this surveillance now, is BA.2.12.1. So this is another variant, a subvariant of Omicron that has kind of entered the picture. And it's also predicted preliminarily to be about, somewhere around 25% more infectious than BA2. So BA2 already be more infectious with the original strains of Omicron. Now BA.2.12.1 is on top of that. So I also encourage you guys to try saying that 5 times fast. It's not an easy one to say. But long and short of it, in terms of the time period of April 10th to the 16th, based upon the forecasting model from the CDC, BA2 is about 75% of the new cases presenting, but then BA.2.12.1 is about 19% of that. So then if we shift over to the right here, and I'll have to close out the Zoom box in the way, you'll see that the largest proportion in terms of that BA2 activity, and especially for BA.2.12.1, is in the Northeast. And so for New England, just to read off the stats for you guys, for BA2, it's about 76% for New England, BA.2.12.1, about 20%. But then what's interesting here, New York and New Jersey, as you can see with this very kind of red pie chart here. This also includes Puerto Rico and the U.S. Virgin Islands, but BA2 is about 46%, and then BA.2.12.1 is more than half, so about 53%. So this is really important because you can see, if you're talking about this new introduction, this other subvariant, New York, New Jersey is right ground zero. And obviously, even though we're part of New England, being the state of Connecticut, our proximity to New York is probably our situation is probably a little bit better represented by what's going on in Region 2 as well. So it's something important to keep in mind. There's a lot of transmission going on in regards to these 2 subvariants, at least, that are in the community. So we have to keep in mind that we just come out of, a major religious holiday weekend. The public school system is currently on holiday break this week. And there's a lot of activities in the springtime, a lot of people traveling and doing other things. So there's a lot of opportunities for not only introduction of new, subvariants, but also just more opportunities for that interaction to result in more transmission in general. So I just really want to emphasize that point. But I think this is a very important kind of piece of knowledge and revelation in regards to what's going on right now. So with that said, this is also kind of further supported by the COVID-associated hospitalizations for the state of Connecticut. This is data going up to the most recent report that came out today. And as you can see, we have about 150 cases or COVID-associated hospitalizations in the state of Connecticut. So that's just really important to kind of keep in mind. What we're kind of dealing with in terms of that, as you can see for the last few weeks, it's just a very gradual increase. Because don't forget, for many weeks before, we were kind of flirting with just getting to 100, but then it was dropping down maybe to the low 90s, if not the 80s. But now it's really broken past the 100s, and now it's obviously just doing this ascent in the hundreds to 150 now. Before that, I believe it was at 136. So just something to keep an eye on as we kind of look at our utilization, because again, that all ties back to this community levels framework, which focuses on a lot of that kind of data. So with that said, hopefully, yeah, here we go. Let's just make sure I jump to the right slide. So yeah, as you can see here, this is looking at the state COVID-19 framework by town and city for the COVID-19 case rates. As you can see, in terms of the density of towns or cities that are in the red, so past that 15 plus per 100,000 case rate, a lot of that's centralized into more maybe the southern part of Connecticut, especially the southwestern portion, as we can see. Norwalk is here in the yellow or the orange, sorry. As you can see, at 13.5 cases per 100,000. This is for the time period of March 27th to April 9th. But everybody is in the red. I mean, even including Stamford, who we typically, kind of more closely mirror. And as from my preliminary calculations, we'll find out this Thursday in the official state health department numbers, but we will be entering the red as well. So that definitely indicates that transmission is continuing to increase, but then we're also kind of getting pulled into this mix. We've held out very long in terms of not entering that higher transmission category per the state framework. So just kind of also looking at it from the perspective of the big 7 Connecticut cities. Norwalk is at 13.5 cases per 100,000. As you can see, the highest is Stanford at New Haven at 21.8. And then the lowest is actually Hartford at 6.8. So you can see kind of where we fit in that spectrum. But yes, our neighbor Stanford is at 15.2, a little bit higher than us, but you can see what the current situation is, and also the discrepancy relative to each of the big 7 Connecticut cities. Relative to the new data from the State Health Department, for the entirety of the pandemic, city of Norwalk is at about 21,780 cases, 270 total deaths. In terms of age groupings, I think this is another important point to hit home, and it kind of supports why we're seeing so much transmission. There's obviously the broad age group dispersion in terms of transmission. So again, this is looking at it from April 3rd to the 16th, but you can see how we're kind of having this curve develop that we saw for a good portion of the pandemic when we were seeing high transmission. And that's the 30 to 39-year-old age group being the largest proportion at almost 20%. But then that's now followed by, it's kind of skewed now on both sides, where you have the 50 to 59, 60 to 69-year-old age group, and then the less than 10 years of age in terms of being the next following highest proportions, at about, 14, 15%, and then 12% with less than 10 years of age. So this is important just to keep in mind because transmission is happening with all age groups. That's what's evident here. But also it's in, vulnerable age groups, right? Less than 10 years of age, but also, our middle age and older age groups, which we definitely don't want them to have COVID because there's greater risk of complications. So, again, the big message here, and this segues into, is vaccination, which will help offset that severity, and also help reduce the risk of burdening the healthcare system if somebody ends up having those severe symptoms. So again, with vaccination for all age groups, initiated vaccination for the city is at about 89%, fully vaccinated about 78.71%, and additional doses received about 40.43%. So again, the message is kind of similar to what we've been saying before. We still have the 5 to 11-year-old age group, which is still kind of under that EUA, straggling to get to fully vaccinated to a much higher percentage, at least breaking the 50th percentile. So we're at 39.84%. But the other thing is, especially that boosters are now in play here, and there's obviously more booster doses that are recommended relative to certain age groups. It would obviously be better to see that additional doses received percentage increase, but it's actually really good to see for 65 plus that it's at 80.31%. But when you look at it from the younger age groups, say 12 to 17, it's at 26.74. And then almost 29% for 18 to 24, 35% for 25 to 44, to 45 to 64, about 56%. So still ways to go. It's following a very linear gradient. The older the age group, the higher that percentile. But we like to obviously see all of them succeeding here and getting a very high percentile to really ensure that that herd immunity more or less, but also reducing that severity of outcomes and maintaining that immunity at very high levels. The other thing I also want to emphasize, given the various unique circumstances tied to mask use and other mitigation measures, and obviously the very high activity that we're seeing right now in terms of travel and other interaction in the community, state, and internationally. But looking at the country, flu is still in play here, even though we have beautiful weather outside. The Northeast actually still is experiencing, a mixture of moderate activity, if not very high, low activity. You can see how Connecticut's a little bit better in that spectrum of that low activity, but New York, Massachusetts, and even New Jersey, and even New Hampshire, it's kind of in that mix of moderate activity, as well as you can see here with New Mexico experiencing very high flu activity, and even like Oklahoma. So it's just important to keep in mind, especially as people travel and interact. Flu's still in play, and flu, keep in mind, is less infectious than what we're dealing with COVID-19. So it's very interesting to see that. But again, it kind of goes to our current circumstances with a lot of activities going on. So the other thing I just want to kind of hit home is just, again, as Teresa just kind of outlined, the testing site has changed to the new site at Lockwood Matthews Mansion, which is right off of I-95, so it's a lot more accessible for not only the city but also for the region too. It's open 4 days a week, so that Monday, Tuesday, Thursday, 2 to 5 p.m., Saturday, 10 a.m. to 2 p.m. In addition to that, just the recommendation to have people kind of report via the self-test portal, just it helps us and understand what's going on, but also we make an effort to obviously reach out to these individuals that request that support to kind of answer any questions they might have and provide additional guidance. Then obviously COVID vaccination is still a very important tool for getting through this pandemic. And then in addition to that, as Teresa kind of outlined, the covid.gov website, and it's really easy to say and share with the community. So, if you obviously engage with other partners or other people in the community, feel free to spread the word. covid.gov is it's a one-stop shop for anything related to masks, treatments, vaccines, and testing. And also people can be, use the locator for test to treat, as well as do requests via the portal to do for masks, as well as at-home rapid tests, so they can always just keep tabs on their situation, especially when we need to contend with the fact that allergy season is here, and it will be playing out for quite some time. So differentiating those symptoms and knowing if it is COVID, maybe possibly flu, or if it's allergies, that's going to be really helpful as a quick way to at least kind of weed that out or get a rough idea what somebody's status is, if it truly is COVID or not, especially when we're experiencing high COVID activity. So with that said, also, last Friday, we just released the bi-weekly COVID-19 report. Definitely suggest you check it out if you're looking for any data, especially any sort of information regarding what the mayor's comments are, as well as other resources. And the covid.gov webpage and other things are listed there as well as the new testing schedule. So the city webpage is where you can find it, as well as social media for Twitter and Facebook. And that is my presentation. Thanks, everybody.
Thank you, Mr. Weeks. Given that we're still in with the mix with COVID, it's always helpful to have these reports every month and this up-to-date data. Thank you. Anybody have any questions for our health department from our committee? I see Mr. Burnett. Thanks, Councilmember Burnett.
Yes, thank you, Chairperson Johnson. Brian, I guess my question is around the use of masks. We've been going through these cycles of mask mandate, and then we take the mask mandate away, and then we bring it back again. What is the recommended, or what has been our guidance in terms of when we reach a certain percentage that the recommendation is to bring back the requirement for wearing masks indoors, restaurants, stores, etc. We've gone from 4% to 6%, and now I believe you said we're at 13%. Is there guidance on when we reach a certain number that we consider putting the mask requirement back in place?
So that's an excellent question. So actually, I just brought it back up on the screen. One of those metrics that it's really going to help guide this process is that CDC community levels by county measurement. And so right now we're in the green, so it's not as high risk in terms of, transmission, in terms of exposure in comparison to obviously what we're seeing in New York and other places as well. But nonetheless, our activity is increasing relative to COVID, because keep in mind, this metric's based more so on the healthcare system burden, right? We still have very high transmission, but we're kind of entering that endemic phase where we're kind of trying to keep COVID as just like flu. We're trying to treat it in that manner. But obviously, COVID is more unique in the sense that it's much more infectious. It has the potential, unlike flu, to kind of linger even potentially in the summer months, because keep in mind we had Delta and that popped up in August. So, flu doesn't usually do that. Flu usually stays around while the weather's still cold. And so it's still somewhat cold and jumping around back and forth right now, but also with the level of interaction, we have more transmission. So in regards to masks, this will be the metric that would help guide a lot of that work, but we'll also be factoring in a lot of the other metrics that I kind of presented before, like the case rate, like just even the state hospitalization numbers, as well as just what we're seeing from our contact tracing in terms of scenarios. And other kind of gatherings that might be contributed to it, as well as what's going on in the calendar too. If it's a big holiday season, that's something very much to keep an eye out for. Now, in terms of mandates, that's, I think we probably share a similar opinion with Commissioner Giuthani of the State Health Department in the regards that, it's obviously with this new phase of the pandemic, we want to be more mindful of how that communication plays out. Obviously there's recommendations versus mandates. I think that's an important thing to emphasize. Just like the CDC has outlined here, these things are recommendations. Now, in terms of face masks, even now, there's no mandate for people to wear face masks now. They are encouraged, especially obviously if they're at risk of experiencing severe COVID-19, if they're meeting some of those risk factors. Say if they're elderly, they have any other kind of chronic condition that might complicate course of illness, or if they're just generally concerned. And if people want to err on the side of caution, we definitely, we would, recommend or encourage that they could wear the mask. It helps mitigate that risk of transmission to themselves as well as to others, because, you know, there's, again, the asymptomatic component tied to COVID-19 we have to always factor in. So somebody is not going to know if they're infected, and then they go to a party or something like that, they run the risk of transmission. So there's no mandate, but, you know, it is encouraged when activity is picking up like this. And then obviously it'll be more strongly recommended as we follow this CDC system and factor in other kind of other measures and other activity relative to the holiday schedule or even the weather. I mean, suddenly we go back into wintertime for some reason, naturally there's going to be greater risk of transmission. But obviously we know how the weather patterns play out. But nonetheless, we're always very cautious as we approach the fall and wintertime. And that's something that we might have to revisit in terms of what would be the next and best steps. And as the CDC as well as the State Health Department evaluate that as well. So that was a long answer, but hopefully it covered your question there.
Thank you.
Thank you. Yes, Councilwoman Ayers.
Thank you, Councilwoman. Chair Johnson, I want to just, for a point of education and reference, as it has been brought to this committee several months about people's inability to schedule meetings. I think it needs to be said for the record that this committee is part of governance, and we do not have the authorization or the authority to mandate city workers to meet with constituents. That is out of the scope of the work that we have been given to do under the charter. And so I just want, for a point of education and reference, it to be stated in the record that we do hear the persistent plea for people asking to meet with certain people and not receiving those appointments. But it is out of the scope of this committee to do anything with that. Is that position correct, Madam Chair?
Yes, I'd agree with you that it's not something that we as council members can do per se. I think if you're in referencing to Ms. Laura Cella's comment, she and I met a few months ago, but I understand that she would like to meet with members of the department, but that's not something that we would be able to mitigate on her behalf, as I understand that correctly. I don't know if any of our other council members want to weigh in on that, but thank you for mentioning that, Ms. Ayers. Very much. Yes, Ms. Smith.
I'll just follow up and add that, you know, our job on the Common Council is to legislate and to work cooperatively and represent our constituents. So while we can't mitigate it, I mean, I just agree with what's being said, but I think that's the important thing, is to remember that our job is to legislate.
Thank you, Councilwoman Smith, and that is an excellent point too. Like, we're here for the residents and our fellow neighbors to bring issues forward to the department heads, but in terms of scheduling meetings for individual residents, right? Thank you for bringing that piece to it, Ms. Smith, too. Thank you, Ms. Ayers. Any other comments for Mr. Weeks or our health department, or questions from our committee? No? All right, so I'll pass the floor over, I believe, either to you, Teresa, or Chair Daniels.
Let me make sure I
our good our good
Teresa.
health department.
Oh, I apologize. Right. Teresa, do you have anything else for us this evening?
No, I don't. Thank you very much.
Thank you, Teresa.
Right.
Thank you, Brian. Return it back to you, Madam Chair.
Thank you. Well, we look forward to seeing you again about your good works, and please have a good night. I believe that you are free to sign off at this point.
No, she has to stay.
Oh, she has to stay. Never mind. Never mind. All right. I see. I don't know. I don't know which I speak. All right. So we've got another agenda item, and this is a fabulous one. For those who are still present on the line and maybe wanting to stay for our community services conversation, including ARPA funding, that'll be coming up. But first, as has been on the books for quite some time, we've got a fabulous presentation tonight with what I believe is a year. We're celebrating a year of the directorship of Ms. Cheryl Harris, who's here with us this evening. And here on our Community Services Committee, excited to pass the floor over to our great library director and learn about all the wonderful good works of our libraries.
Oh, Lord, you just set me up. I hope I'm as good as you said.
while we're celebrating that, we're all good. Thank you, Ms. Shrub. Thank you, Ms. Harris.
Thank you. Hello to my fearless leader, Lamont Daniels, and welcome to Anna Vivian. I haven't met you officially, but welcome. And hello to the esteemed Common Council Committee. So let's see, I have a PowerPoint. I just lost the screen.
So to our team, can we make sure Sherelle has sharing access, please? Thank you very much. Thank you.
Can you see it?
We can.
Wonderful. There we go. So you already know who we are. Okay, so first of all, thank you for allowing me to share the wonderful work of the Norwalk Public Library. We have a wonderful staff, and I just will share some highlights. Lamont told me that I have about 2 hours. Is that correct?
I had to unmute there to laugh. Yes. No, not quite.
Sorrel.
That's a good one. That's a good one.
Okay, so last week, or April 3rd through 9th, was National Library Week. And National Library Week, it was first honored in 1958 and is sponsored by the American Library Association, also known as ALA, and it's observed by libraries across the country each April. So this April, we decided to celebrate the legend of Dotha, Norwalk's very first librarian. So Dotha has been a long-time enigma at the library. There's a plaque in her honor at our main library on Belden Avenue. Staff have admired her revolutionary, non-traditional role as a librarian. She initiated fresh contemporary services at the end of the 19th century and the beginning of the 20th century. And I'll just give you a few highlights. She created entertaining library programs, which were named the Storyteller's Hour. She was a prominent lecturer on the history for New York Board of Education for 10 years. She was the secretary of Connecticut State Federal Women's Clubs, a suffragist leader from Connecticut. She introduced local authors, and she inaugurated a children's garden contest. And now the library has a seed club. So if anybody's interested in the seed club, you can contact Cindy Leahy, who is our fearless head of adult services. And so, if you want to know, a little bit more about Dotha, you can always visit the library. At present, we have a display that will be up until the end of April. So I thought, just for fun, you might be interested in knowing Norwalk Public Library's top 10 fiction books. So actually, these are the top 10 books that have been checked out for March. I'll just let you see. Of course, I know everyone has read at least one of these books, right? So this is fiction, nonfiction, and our top ebooks for those of you who prefer reading virtually. So we have some really exciting things going on. We have our auditorium will be upgraded. Norwalk Public Library gets several hundred requests for meeting rooms. Anything from having condo association meetings, from tutoring, functions. Next week, we have the Daughters of the American Revolution coming in. So we get tons and tons of room bookings. So we're upgrading our auditorium. COVID has, I think all of us, are probably experts with Zoom by now. So some of us are tired of Zoom, some of us prefer Zoom. So the auditorium upgrade will allow us to have, virtual presentations in real time. So people can, come or they can watch virtually in real time. So that's something new for us and we're really excited. So we're updating the camera system, lots of things in our auditorium. So this is the South Norwalk Library. This projector, so we're updating the projector, the screens, the sound. So, you know, it'll be a really nice experience for those who want to book the room at both libraries. Another exciting thing is our, you know, that's coming, our laptop kiosk. So you can just, you know, go swipe your library card and borrow a laptop. So this is a generic laptop dispenser, but this is what it'll look like with the Norwalk Public Library branding on it. And these are for use in-house. Just some statistics. Libraries, a lot of people come to use, the people who were speaking earlier about South Norwalk, and I think Norwalk in general, a lot of people, you know, come to the library to use the computers, whether they don't have a computer at home or whether they do not have connectivity. So for a while, we were seeing lots and lots and lots of people coming in to use the computer. Roughly around 2018-ish, more people started bringing their own devices and they wanted to use our free Wi-Fi. So these are computer usage in sessions, excuse me, by location. It just gives you the idea of how many times people log into the computer systems at the different locations. And this is just, it's combined. So it's the adult usage in both libraries, the teen usage in both libraries, and children's usage in both libraries. This is computer usage in minutes. So how many times, you know, people stay on the computers by location. And then, I knew I was going to do that. I'm sorry, this should have been combined. I'm sorry, I don't have that one. So last month, excuse me, Norwalk Public Library, you know, was contacted by Connecticut Public. They contacted, you know, all libraries across Connecticut. So we are special, but we weren't special in that regard. And basically, so Connecticut Public is the statewide home of PBS Kids, which is celebrated, and they celebrated National Reading Month in March. And they invited all libraries to participate. Vicki and I, our children's librarian, we recommended 6 children's books, but we did it in honor of Women's History Month. And Connecticut Public provided PBS bags for us to give away to our patrons. And here are just a couple of the cute little pictures of some of the youth who received the bags. Oops. And so the ARPA grant, I applied for an ARPA grant via the Connecticut State Library. And these are just some of the things that we purchased. So we have, COVID highlighted the need for hygienic chairs. So not having, you know, the soft, the cushion chairs, but chairs that we can easily wipe down, you know, between usage. And so the children's library at the main received these chairs that you see. The main library purchased these chairs. And what's nice too is now we have, even hygienically, it's great, but we also have, you know, a set. We don't have hodgepodge, this type of chair here, this type of chair there. So aesthetically, it's also very nice. And we have a pod. So this is our soundproof pod where people can go in, you know, to study, to tutor, have a job interview, and also for telehealth, which we've explored with New Vans Health. So, you know, someone, that's sort of the new thing, you know, via COVID. So just say someone has an appointment at Yale, they don't have a car, perhaps they can come in and speak with their doctor, you know, in the pod privately. And the pod will have a telephone line. It will have a flat screen computer So we're pretty excited. Unfortunately, it was delivered with the wrong size door, but we hope to have it up and running by hopefully by July when the new door is delivered. You know what? We also have, I don't know if Diane is still on the phone, but we also have a solar charging station. And unfortunately, I didn't put that picture in. But people can, walk up and, if they're riding by or walking by or just, using the library, if they need to charge their devices, we have a solar charging station outside. And that was also purchased with the ARPA funds. So this picture is what the South Norwalk Library may look like. And thanks to the Common Council and to the mayor and to our board and to everyone who supported this project, the South Norwalk Library will have a facelift, which is needed. It's, the rooms are a little small and we have so many room bookings and we only have the auditorium. So, we wanted an upgrade, but we also wanted to be able to repurpose the rooms quickly without having the heavy furniture. And, in case someone wants to use the reading room for, let's just say, maybe author signing or, quick reading, we can move the furniture out quickly and, repurpose it, for that purpose. Also, we've seen an influx of the elderly coming into the Sono Library, and it's very refreshing. And, we wanted to have a space where they can comfortably sit. And also with people using their own devices, I might be able to see here. We'd like to set this up like as a bar, not a drinking bar, but, have bars where with lots of electrical outlets where people can use their own devices. So this room here would be sort of the computer room, and this room here, the reading room, which is really nice because you have the seating, nice seating. Also, it looks like it's soft seating, but you can wipe it down and in front of the window, which gives the natural light. So this is the choice in the darker wood, and that's the choice in the lighter wood. And that's it for me. Solomon, it wasn't quite 2 hours, but does anyone have any questions?
Yes, any questions from the community about what we've seen or or comments about our libraries? I'll put us all in gallery view. All right, in no particular order,
There's some raised hands.
I saw some raised hands. That's right. I think Ms. Ayers, then Ms. Revolution, then Ms. Smith. We'll start with Ms. Ayers.
Thank you, Chairman Johnson. I would like to just applaud Sherelle for something that happened a couple of months ago with when you removed the fees from the books. Thank you on behalf of the community. People have gone through a great pandemic, and lessening fees is a way for the community to really show that they care and they understand the plight of many people. And I know that you had your own motivations and stuff, but I wanted to really take this opportunity to say kudos and thank you very much for providing that service to all people that live in Norwalk. Additionally, I like the darker wood for South Norwalk.
I don't like you right now, Nicole.
You be all right.
I like the lighter wood, but
I like the lighter.
They came in, they were like, "Oh, Sherelle, no!"
I like
made me start rethinking the darker one.
I like the darker wood
publicly, so now I'll never live it down.
Well, it looks very prestigious. I like the darker wood.
Like it's a piano recital, so
but
you can't go wrong either way.
I also wanted to just also acknowledge your innovation on the team of your innovation for the pods. I feel that where you're taking the library is a place of innovation and more of a community-minded center that just happened to hold books and resources and educational material. So I really like what you are doing, what your team is doing at the library. I know you have long nights and it's not always weary, but I want to take the opportunity to give you kudos. It is being recorded, it will be blasted, but I wanted to give you kudos and say that the council, many of us on the council, see the endless and hard work that you do, and we appreciate you and appreciate the position that you're in. Thank you very much.
I just want to comment and say thank you, Nicole. You know, I'm an equal admirer, so thank you so much. So I have to give some kudos back. Lamont, you know, who is our fearless leader in community services, you know, his idea with the navigators and things like that. So a lot of this was birthed out of conversations with him as far as, you know, what can we do for the public, you know, and getting rid of fines. Vicki Otis, our children's library director was, you know, also, you know, very much behind this. Our library board approved it. So, and we're appreciative of the city, you know, for allowing this, because that pot of money went to the city. So they could have easily said no. So kudos to the mayor and Lamont and everyone else. The innovation is a team, and I wanted to put that up here so you can see the team. Cindy Leahy, Director of Adult Services, Vicki Otis, Director of Children's Services, Lori Iflin, Director of Library Technology, Dawn Preverick, who, you know, does a lot, but one of those jobs that's never really seen, as well as Kathy Welcher. So that's our team. And as far as the pods, I wish I could take credit for that. That credit goes to Luis Ayala, who is one of our reference library directors, librarians. So, but thank you. The team is doing a great job.
Thank you, Councilman Ayers. Thank you, Ms. Harris. Before I give the floor to Ms. Revolus, was hoping maybe we could unshare the screen if possible.
Oh, sorry.
The con. Oh, is that you, Sherelle? I'm sorry about that. Oh,
no, that's okay.
We're good. All right.
Okay,
Thank you
now.
very much to see all of our faces now. Very good. Yes, Councilwoman Revolus.
Well, first of all, you keep saying fearless, but your work of intention, to me, especially as someone who looks like me, is what I would consider not only tremendous, but intentional in its fearlessness. I look up to your movement and what you do. I, again, have never walked in there without getting a book that I needed from you. And in particularly, I also want to speak to the array of books that look like us, that you have, that I want our community to understand we hold. And Sherelle does a diligent job in bringing in, and I want our community to come in and check those out, read them, watch our videos that she holds. There's so much information that are just a beautiful capsule within our library, especially for South Norwalk. You're very commendable in the way your love for reading, which we share. And I appreciate your diligence. I appreciate your care. And I appreciate, again, your intention. I can't say that for everything. I can say it for you. And I like the light brown. I think it brightens up the place. I do. I think it brightens up the place.
That's going to be the debate of the library too.
It's going to be the debate, but I really think that it opens up the space. I think it looks like a brighter area. You know what I mean? You know, Miss Ayers, we usually agree. I'm sorry. I like the lighter, but I commend you for your first year. You're doing a great job. And I can only say people could feel comfortable to be fearless around the direction of you. I thank you. And again, there is not a time or a place when I've walked in there, talked to you, and not got a book I didn't need. And I get every book you tell me to. I order every book you say. And it's always been empowering and tremendous. And I think for our community, in particular, I'm talking to Black people directly, to see one of us doing what you do and make education and intelligence be fun and smart and cool. Keep rocking, keep doing it. And particularly for anybody, like I might have, you know, with some tears, but I think about my times in Ferguson Library as a teenager, and those pods and that quiet space was very important to get my work done, get the study, get out the way of, my house. So I think that's a very important look. And again, I just commend you and your work, and I love the library. I love seeing a different look for South Norwalk's library, and remembering that we have South Norwalk's library too, right? Our main library is amazing, but there's a big need in the South Norwalk one as well. And it's a beautiful look. And again, I'm gonna go with the light, but congratulations. I thank you for being where you are and who you are. And I need about 2 more books, so I will call you.
Come on
That's
down.
it. I will. But that's it. That's all I wanted to say.
Thank you. Thank you so much for that. And to Diana's point, I am a very proud African-American person, but because I love myself, I have the ability to love everybody.
In that order.
So white, black, Anna Vivian, you have to come down and check out our Espanol collection. And we love everybody. And I think it's evident.
Can I just add?
So
can I add to what you said?
Sure.
One of my sayings that I always say is, I love myself greatly so I can love others correctly, right?
Okay.
So if you can do yourself love, if you can love yourself greatly, you can love people intentionally, correctly, and in the right way. And in particularly, when it's okay to be in your skin, it's okay to be around everybody else. And you make it okay to be in your skin, in our skin. That's all I have to say.
Oh, Councilwoman Smith.
Yes, thank you, Chair Johnson. I too would like to commend you, Sherelle, for the work that you have done with the libraries. I mean, Ms. Ayers really nailed it in terms of innovation and community-centric, really bringing the community in and making a space for the community. So I think it's really, really fantastic, really innovative. Mike, I have a question, more like in terms of programming, because I imagine that you're seeing, since the pandemic in particular, probably less interest in reading books with kids. And I know that, as a former teacher in our schools, we always worked so closely with the library to establish, summer reading programs and get the kids library cards and get them reading books. Do they have any interest? Are you seeing, do they have interest in reading books? Either digitally or picking up a book. I mean, I myself read on a Kindle because of my eyesight and it works for me. But are kids reading, and what are we doing to encourage reading?
I haven't really seen a huge drop, maybe when we were closed, but since we opened, people are coming back in. You're always going to have those parents who they're just going to introduce their children to the library, so you don't have to worry, about them. But I think we have a multicultural and a well-versed team who can reach out to all others. When I was a children's librarian, as well as YA, that was my goal, was to find the reluctant readers. So whether, we went into the projects, or to low income neighborhoods, like we were all over the place, just versatile. We can go to stepping stones as well as, to a housing project. And, we have our pop-up truck. Vicki Otis is very, she's very entrenched, with children's literature. Lisa Story, I have to plug, she's the YA. She has a really good pulse on what the youth of all cultures are reading. So I just think with the pandemic, it's just getting, used to being back in the building. But, Norwalk's a pretty intellectual community. I think people are reading. I commend, the people who were speaking earlier, some of whom I've worked with, who want to get out into the community and do a little bit more, perhaps, to the underserved communities. But, Norwalk's a pretty sophisticated community. People are coming in, and it's just a matter of being able to meet the different tastes you know, like I was that person like, oh no, we're not having Captain Underpants in our library. We're not having Junie B. Jones in our library. But the boys kept coming in like, what are you crazy? You want to have Captain Underpants? We have Captain Underpants. And I actually read Junie B. Jones and I fell in love with her. And so, you know, it's just, I was like, oh no, the grammar, oh no. But it's just a matter of making sure that there's a book or a subject for all of the people in our diverse community. And I think our team does a great job at book selection and, you know, just programming and different things. If you go on our website, you can go to either library and you'll see a wealth of programming. So,
great. Thank you.
Yeah.
Excellent. Councilwoman Alterman.
Thank you, Chair Johnson. I just wanted to say, which is an obvious thing that I'll say, but I love the Seed Library. Not only is it just like a great program, but you guys actually pick really nice seeds. So it was very, very exciting. And I was so glad that you guys still did it through the pandemic. My first thought was, oh no, that's going to go away. And I wanted to say, as an adult, I have 3 children. I have used like the meeting rooms at the library repeatedly for studying. I didn't know those existed. And some nice person, when I called the library one day, was like, you know, I'm looking for this, but I had to be doing a loud activity. And they were like, we'll put you in the, you know, in the one in the corner. It was totally fine. And they were so accommodating and kind. And I always just love both of our libraries. So when my kids were little, they used to say the library was their favorite place to have a play date. And like, it was pretty amazing. I was like, wait, what? And then anyway, so we love it. And I love everything you've done. Thank you.
Tell me more. No, I'm just kidding. Thank you. But the team, yeah, I have to say it's a great team.
Yeah, your team there, Sherelle, Director Harris, is phenomenal. Under your leadership, I'm so excited to see what they're going to do next. And I saw Ms. Revolus, Councilwoman Revolus also has her hand.
I just forgot to ask one thing and say another. I've never seen the truck around so much, and I'm really happy to see that. The library on wheels type of thing. I see it so much now, and I'm so happy about that too, right? Like I used to love that as a kid. Like anyway, I'm glad to see that. But my question, and particularly because of this, you know how I feel about it. Do we have a section in place that actually, just because we were talking about seed, that it speaks to nutrition and educating maybe people on nutrition? Because from what we're going through, there'll always be variants, blah, 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 blah. Giving different spaces and places for nutrition. I'm just wondering in our libraries, do we have that?
Right in our Dewey Decimal System. You can, I think it's like the 600s. Yeah, there should be something. So it's not a specific section, but it's a section because it's part of the Dewey Decimal System.
Okay. Do you think we could like ever do a program or do stuff or categorize it in a way that, like, you know, maybe if people just want to know, you know, alternatives that they can just come to and say, I'm interested in? Like, do you think we can put that a part of it?
We've done that before, and I know I partnered with the Norwalk Health Department many years ago, and we would have speakers come in. I remember when we did Small Plate, and we had, you know, people come in from Norwalk Hospital. So we did a whole series on, or we might watch, you know, a film and discuss it, but have an expert come and speak. So that might be worth reviving.
That'd be great. That would be great. I think that would be a good time for it too, you know?
Oh yeah, without a doubt. And hopefully, like with the telehealth program, Cindy, Luis, and I spoke with someone at New Lance at Norwalk Hospital, and we're thinking of kicking that off by having, you know, a lecturer come in and talk about telehealth. So that might be worth, you know, bringing up some other things too.
Wonderful. That's all I wanted to
have
ask.
you come and speak, Miss Diana.
You know I will. And I'm a person who, and just for those people who still love the smell of books, I'm not a Kindle person, but I still love the smell of books. So I'm a little cheesy, but I would love to come in. And if we can do that, I think it would be a perfect time for it. And you would be the perfect person to navigate it.
No, we've got a good team. So
Well, yeah,
That's
I mean,
absolutely.
and the team, I kind of see the team as a total tempo when I talk to her like that. So sorry, not to disregard any of you. You're doing an amazing job at the library, both South Norwalk and Belden Avenue. Like the total of you are amazing. Please don't take me as disregard. I kind of just see your leadership as the trickling down, but please take the love when it's trickling down. Like,
I will. I'm receiving it all. I'm actually looking for what we did, but thank you, Diana. Oh, actually, here it is right here. So we did do, it was called Food and Naturopathic Health. Oh gosh, 2014. That was a long time ago.
But that'll be perfect. That's exactly what I'm talking about. Food and
So,
naturopathic areas. Yep.
yeah. So,
Yeah.
yeah. So
That'd be
thank you for
amazing.
saying that. We can actually bring that back.
Thank you.
Excellent. Any other committee members have comments, questions, responses to the library presentation tonight? I just want to say, Ms. Harris, thank you so much for coming. We were very excited. We're doing our tour of all of the various departments of community services through our committee here. And boy, we've been excited for this one. So thank you.
Oh, thank you. My pleasure.
And I know that I am not going to weigh in on the wood tone. I like both.
You're such a politician.
No, I literally can't because I see both. Like I do like the prestigious aspect though of the darker wood. I kind of get that, but I'm just glad I'm glad it's happening. That's what I'm going to say. So I'm just really glad that has been ushered through the finance committee onto the council, and we're seeing this Sono Library project because of what it means for the community at large and how welcoming that space already is, but what this is going to do to it is so wonderful.
Yeah,
so
I'm so excited for that.
Yeah. No, I mean, if it's important enough, I'll take a stand on it, but I think that it's
okay.
all.
What are your real thoughts?
My real thoughts? I think the more I think about it, I'm gonna split our vote and go for the darker tone wood based on what Ms. Ayers said. It's like, the college library vibe, maybe. Yeah, I don't know, but there it is. But whatever it is, I'm gonna be there and I'm gonna love it. So thank you.
All right, thank you. And thank you.
All right, everybody, and thank you, Ms. Harris. All right. I see we have now on our agenda, and I believe this means, now I understand now why Ms. Teresa had to stay, but I believe Chief Daniels, we can gladly bid Ms. Harris good night. Is that right?
That is correct. Thank you so much, Sherelle. Thank you. Great job. Great presentation.
I may stay and just listen a little bit. I may sneak out a little bit later.
Thank you. Perfect. Thank you so much. Mr. Chair Daniels, I'll give you the floor for your report and a wonderful introduction we've got tonight. And then we have some items to vote on, I see, for early childhood and the health department.
Thank you very much. And again, good evening, everyone. While the DEI is not explicitly on the agenda, I can again tonight remind the public that a month ago, and I may not have my dates with me because I don't have it in front of me, that from this committee, it was recommended that the administration explore having a DEI officer, and Mayor Rowland committed to presenting that as part of the fiscal 23 operating budget. And so we are still in that process. I'm going to lean on you all to remind the public when that final vote is. However, I am authorized to say that it is looked upon very favorably, and we are really looking forward that once the budget is officially approved, we can then make a official announcement. But I also will just say, but that's just the beginning. It's one step also to reassure the public that we are committed. While many are waiting and saying now, tomorrow, or yesterday, I'll stand and remind that we are moving course. And I want to thank this particular committee for the support. And we have to do the hiring and what the qualifications are. We are working to do some of that simultaneously, but don't want to move too far ahead because for me, I want it in writing first before we do everything. But it's important to share that we are moving in the right direction. And once the Common Council and the budgetary process is final, we look forward to sharing that and look forward, similar to COVID, to provide monthly updates. And that is all taken consideration. So thank you for that. Also, I would like to share to this committee and to the city of Norwalk, your new Human Services Director. Ana Vivian Estrella joins us as a senior level executive with an exceptional track record managing complex organizations. Prior to accepting the position, she served as the Chief Program Officer of Permanent Housing. And prior to that, within the same organization, she was the Chief Policy and Compliance Officer at Inspirica Incorporated. Inspirica is one of the largest providers of services to the homeless in Connecticut and the largest in Lower Fairfield County. Ana Vivian is an attorney and holds an MSW with a strong commitment to underserved populations. Her years of experience include leading systems improvement efforts, child protection, child welfare work, immigration work, child and family services, advocacy, housing, and engaging in legal proceedings, as well as being a leader who understands needs and strengths and designing solutions. I am so excited to welcome Ana Vivian as a member of the Community Services Department leadership. She's a strong asset to the team as we move forward, and particularly as we look at the efficiency study, as all of our departments will be, to think through what that looks like and how we might make those changes. In Anna's role, she will oversee early childhood coordinator, Mary, welcome, good to see Mary, our youth services programming, our family navigation program, our fair rent, and our ADA programming. So I want to welcome Anna, and I also want to take pride that Anna is a Norwalk resident. So to this committee, to the city of Norwalk, will you please join me in help me welcoming Ana Vivian to the city of Norwalk as the Human Services Director. Anna, I said a lot, but would you mind introducing yourself specifically? Anything that I did not share, what would you like to share with the residents? Because this is being broadcasted live on YouTube and it will live. And also to the committee members, welcome Ana Vivian.
First, I just want to say thank you for the warm welcome. Both Lamont and his leadership and the team has been so gracious. It's week 2 and I've learned a lot. And I look forward to learning more. And it's also nice to see some known faces. So I've had the pleasure of meeting some of you in advance and interacting with some of you on different projects. And so this is just, the beginning. And I look forward to collaborating and really seeing what I can bring to the table. I have been a nonprofit for a number of years. and so I really just look forward to bringing what I can bring to the table to create a collective impact for our residents here and for my children and, all of us that live here in Norwalk, and being able to bring change to the community I live in. This is my first chance where I get to do that. So I'm really looking forward to it. And thank you again for just the warm welcome.
Thank you, Anna, Vivian, and Madam Chair, I'll turn it back to you because we will do the ARPA at the end.
Very good. Thank you, Chief Dance. Welcome to the department, Ana Vivian. I see, Councilwoman Rivas, is that your hand from before with the library, or is that you're good? Okay. Well, we are so happy to have you here. Thank you so much. And we're excited to be able to work with you here and support the work that you're going to do. So thank you. And I know we've got quite an agenda still, so I'll keep us moving. And that means we're going to get to our voting items, our action items. And as Chief Daniel said, we're going to return to the American Rescue Plan Act Recovery Fund program with the agenda action item at the end. So now we go to early childhood, and I see we have Mary Oster here. Welcome this evening. And I have an action item I'll read out, and let's see, I will read the motion. I'll ask for someone, let me read it and then I'll ask for someone to advance it. Early Childhood 1, authorize the Mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept the School Readiness Grant, which includes the Quality Enhancement Grant for the period July 1, 2022 to June 30, 2023. Do I have a motion for that? Mr. Burnett, I saw your hand first. Mr. Burnett has moved the motion. I suppose, Chief Daniels, that I'll leave the floor to you as to who you'd like to speak on this.
Thank you very much, Madam Chair. So Mary, I'm going to lean on you, but then also I believe Carol is new, and can you then facilitate Carol introducing herself? Because we may have to go before this committee in future opportunities, so they would know and know who Carol is. And we're really excited to welcome Carol to the city of Norwalk and the work that Mary leads on behalf of the city on the city side. Mary, take it away.
Okay, thanks. Hi, everybody, and thank you. I just want to introduce Carol Carazelli. Some of you who have been on the committee for a while may remember Jamie Zyla. Jamie has moved to a different position. Carol is employed by Norwalk Public Schools as the School Readiness Liaison. So she will manage that school readiness grant, all aspects of it, including the quality enhancement. So I'll introduce Carol to say a few words about the grant, and here you go.
Thank you. Good evening, everyone. So I've been the school readiness liaison for Norwalk for about 6 weeks, and it is time for the grant renewal for the town of Norwalk. And the school readiness preschool program provides affordable, high quality early child care and education services to the high need communities that help young children prepare for kindergarten. And it's been in Norwalk since around 1998. And several different providers throughout Norwalk, and some provide all day, some provide a shorter day of care. Some of the programs are located in the Norwalk Public Schools. They serve 3, 4, and 5-year-olds. And I would like to just say a little something just about the providers, that their dedication, and even just what I've seen in the last 6 weeks, the care that they take for our youngest in Norwalk, keeping them safe during this time, staying open so that families can work, you know, caring for the kids and really getting them ready for kindergarten. And it's really amazing what the providers here in Norwalk do. And just wanted to give them a little shout out. And the grant total is $5,474,168. And I think that's kind of the highlight. I had shared some notes previous, so I don't know if people had a chance to read it, but I'm happy to try to answer any questions. And I'd also like to say that I am a native of Norwalk. I grew up here, and I'm so happy to be back in Norwalk. So.
Excellent. Thank you so much, Carol. Thank you, Mary. Any questions or comments from the committee about this grant? Seeing none, I believe we can take a vote. Just for clarification, we do not need the dollar amount listed in the authorization. Is that correct, Chief Daniels?
That is correct, Mary. Have we noted that in previous? I'm going to lean on Mary for that again.
You know, Jamie handled that. I
don't think it is necessary. I shared it, but I'm pretty certain it's not.
Okay.
Very good. I figured. Thank you, Carol. Thank you, Mary. Wonderful. So we can vote on this item. All in favor of the motion put forth by Mr. Burnett? You can raise your hand or say aye. All no's now? Any abstentions? That was unanimous. Thank you all so much. Thank you, Carol. Thank you, Mary, for that. And thank you for all the good work you're doing. Early childhood in particular is so crucial. Yes, Ms. Riverloose.
Just a question, please don't take me wrong. Why wouldn't we say the amount? For transparency reasons, why wouldn't we? And I'm just maybe be naive. I'm just asking, and please forgive me if it's a wrong question, but why wouldn't we say the amount?
Yeah, I don't think it's not that you shouldn't share it. I think this is primarily to get the okay for the mayor to authorize, bringing this to Norwalk. I'm not sure, but in the reading material that I went through, it didn't seem necessary to highlight the amount. I don't know why.
We just have to look into that, and if
Yeah.
I don't think there's a right or wrong specifically. I'm going to lean on some of our colleagues who've been seasoned in this.
Yeah, I saw Miss Vivian and then Ms. Ayers as well.
So it's just a procedural mechanism. So right now, what you're voting on is the ability for the mayor to sign for the money. It's a fiduciary duty, and you're giving him permission to accept that money and to apply for that money. So if you add like a specific dollar amount, you're saying he can only apply for that specific dollar amount. And so that's why generally you don't say a specific dollar amount. You just give him the authorization to apply and accept. But it's not like trying to take away transparency. You can definitely talk about it and it ends up in the budget and all of those good things. But this process and this motion in particular is just for him to have the ability to apply and accept.
Okay, so I understand. Like it would be more clarified once, what's the word I'm looking for? Once received type of thing.
Yeah.
Okay.
Absolutely.
I get it. Sorry for that. Thank you.
No, sorry at all. That's a good clarification. And thank you, Estrella, for that. Ms. Ayers? Oh, you took your hand down, so we're good.
Yeah, I was just gonna help answer the question, but Vivian answered it. So.
All right, we did it together. Thank you so much. And thank you, Director Estrella, for that. We've got, and that is passed. So thank you, Early Childhood Department, for everything you do.
Thank you all.
Thank you. We have a Health Department authorization, which I believe, let's see, I'll move the first and then 2A, 2B together perhaps. So one, Health Department, authorize the Mayor Harry W. Rilling to execute any and all agreements, documents, instruments, or amendments as may be necessary to contract services provided by the Health Education Center at a total cost of no more than $2,500 for the purpose of employee training and education, account number noted. Would someone like to move this item? Councilwoman Regaluz, thank you so much. Any from our Health Department, would you like us to move? Well, I think we'll just have a conversation about this and then we'll move the second one on its own.
Great. Thank you. Teresa Argandesi will be leading the discussion for you all tonight.
Sure. So for this item, we're looking to get authorization to sign a standard business agreement to contract with this agency to provide us with training on a variety of topics related to health equity, cultural humility, everything from the best practices for use of medical interpretation to communication skills for among people of different cultures, and a variety of health equity topics. And so the cost is like you had mentioned, Councilperson, no more than $2,500, and that would cover training for 30 of our staff members.
Fantastic. Any comments or questions to Ms. Teresa about this employee training? Sounds like a fantastic opportunity and one for so many of the department. I think that's phenomenal. If there are no questions or comments, seeing none, oh yes. Ms. Revelous, was that you? And then
I don't know if this is really, again, a good question, but I just maybe because my thing with medicine, since I came from it, like maybe divulging a little bit deeper into this training, because and particularly the inequities in medicine and your training for equities, but how you're implementing the training and what you're being training can also be inequitable. So I'm okay with you getting it. I'm just unsure about how it's being done, if that makes sense.
Sure, absolutely. So in terms of detail on the curriculum or the lessons, I think I would need to look a little bit more at what is available from the contractor ahead of time. I do know that it is an organization that has done trainings like this for some time, associated with the Connecticut AHEC organization, so the Area Health Education Centers. And so I could get you some more details if those are available. Definitely.
Okay,
And
if you could,
and
I would appreciate it.
Sure. And I should say too, that it's just one piece of training in this area, and that we're always looking for additional professional development and training and in-services to assist with rounding out that that training and information.
Okay, thank you.
Excellent. Mr. Burnett?
No, I'm sorry. I did not have a question. I thought you called for the vote, so I was raising.
Oh, well, then we're ready. All right, thank you. So now we're ready. Thank you, Mr. Burnett. All in favor? Oh, I should say any more questions, but I don't think there were. No, I don't see. So all in favor, yes. And any abstentions? No's? It's an unanimous as well in support of that. Thank you so much, Ms. Argondesi, for that. And you'll stick around, of course, because we have one more health department, which I'll move now together. 2A is authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept grant funds from the state of Connecticut Department of Public Health for the, quote, a public health approach to comprehensive suicide prevention in Connecticut, end quote, program in the amount of $159,000 for the period August 1, 2022 through August 31st, 2025. And 2B, authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary to implement the, quote, a public health approach to comprehensive suicide prevention in Connecticut, end quote, program for the period August 1, 2022 through August 31st, 2025. Those are now read. Who would like to move those? Yes, Councilwoman Smith, thank you so much. Any, I guess I'll also, Chief Daniels, but I assume this goes back to Ms. Argondesi, so.
Sure. So this was an opportunity that was presented to us quite recently, and we're still awaiting final contractual language and details. But the State Department of Public Health and the Department of Mental Health and Addiction Services has this opportunity available to some local health departments around the state. And the scope of work includes some broad general activities, including participating in regional and state advisory boards around suicide prevention, developing or creating or updating inventory of existing initiatives and resources in this area, developing work plans for suicide prevention, intervention, and response for our area, and implementing evidence-based intervention strategies in a variety of settings. In addition, looking at health data related to suicide in our community and in our region. And so when we discussed this with the health department at the state level, we thought this was an exciting opportunity to bring additional resources to our community, understanding that there are some amazing community partners that are already really entrenched in this work and doing great work in this area. And so we are hoping to utilize these resources to really leverage what they're already doing, partner with them on the great work that they're doing in the community, and then also try to supplement and enhance wherever we can.
That's fantastic. Any comments, questions about this? Yes, Ms. Smith.
Teresa, just is there any particular age group that will be focused on, or is it just, overall, suicide? And, we know that suicide is and suicidality is such a major issue among our young people. It's gotten so much worse with COVID and certainly the adult population as well. So I'm just curious if there's a particular focus.
Yeah, that's a great question. The State Health Department has identified some priority groups. Some of it will depend on the data that we pull from other sources to make that what they're seeing at the state level is also true in our community. In terms of age groups, young people are among the priority age groups. I will tell you that they've identified enough age groups that it really does cover a lot of the population. But we were also particularly interested to see if they wanted us to work with youth, and that is among the groups that they're targeting.
Good, thank you.
Sure.
That's an excellent question. Any others? Yes, Mr. Burnett.
Thank you, Committee Chair. The one question I had as I look at this grant, because I did not see it in the backup, does this grant have a matching grant component, meaning the city has to match a portion of the grant, or is the full 159,000 the grant and there's no matching component?
As far as we're aware right now, there is no matching component, no.
Okay, thank you.
You're welcome.
Yes, Ms. Revelous?
Not to sound like a broken record tonight, but is there cultural connections to these suicide preventions? Because there is, our data does show in particular different groups, but like, for example, how you deal with a Black male versus how you're dealing with a, white female. Like, is there cultural connections to that as well? Just not to sound like a broken record, but whatever. I just kind of want to know.
No, that's an incredibly important question. I will say we're in the very early stages of understanding what kinds of evidence-based programs they're asking for and how much of that, what the background on those are. We're also expecting to lean pretty heavily on our partners who are doing work in this area already to better understand. But what I will say is that we have every intention of trying to make those connections if they aren't already part of the state's recommended process, and then also trying to engage residents and community members in the process as well to find out what's working and what's still needed.
I appreciate that, because in particular with some populations, there's a hard stigma against speaking about their emotions, and they carry a lot of it on a every normal day basis, in particularly our men, but there's just the stigma against speaking about it. So I'm wondering if there's a way to break through that.
That's a great point. I will definitely make a note of that and make sure that we highlight any opportunity that we have to make those connections.
Great point. Thank you, Ms. Revelous. Ms. Alterman.
Hi, thank you. Teresa, I'm not sure if this is for you or Lamond. I know the city used to offer direct counseling services within I forget the term. Would any of this grant money be able to bring that back? I think it goes to what Ms. Revelous was saying. In some situations where the kids having trouble may not seek out therapy services on their own. I thought that was amazing that our city used to do that, and now we don't. We do like a refer out. I'm just wondering if any of this money could bring that back, or if that's just the city's not doing that.
No, thank you, Councilwoman. The city is not doing counseling anymore. It was an administrative decision. I should also tell you that there was an assessment when I arrived here to look at the city's role in mental health services. And from that assessment, talking with local providers and looking at the mental health array of services, not to suggest that there's not more, but again, looking at it thoughtfully around, should the city continue providing direct services? And we deemed a decision that it was not appropriate at this point in time in 2021, prior COVID, that the city would no longer take on that role.
Okay, thank you for answering. I think I found it confusing because like we expect schools to do it, but we don't expect the city to do it. I will follow up with you later. I don't need
Sure.
time, but that was one of the concerns.
Certainly.
All right. Any other comments or questions about these items? Just to echo some of what's been said, I saw the data, especially from Norwalk, with the Norwalk partnership about suicidality coming out of COVID, and it's just beyond alarming in terms of the effect of COVID on certain marginalized communities in particular. So thank you for bringing this work, this grant money, this work to Norwalk. Thank you so much. With that, we can call for a vote. All in favor? And any noes? Any abstentions? That's unanimous as well. Thank you so much. And thanks again for this work. And I'll defer to Chief Daniels if this is your time to sign off, Health Department, but thank you, Health Department, for everything.
Yes, thank you. And Brian, I didn't know you were still here. Brian and Teresa, you are free to go.
All right.
Unless you have a strong desire to stay on.
Have a good night.
Have a good
Thank you
evening.
both.
Thank you
Thank
both.
you both.
And before I give the floor back to Chief Daniels, I see Ms. Sherrill Harris has her hand up.
Yeah,
so
I just
floor briefly.
Pertaining to your topic this evening, I wanted to share an article that's in the Atlantic. It's called "Why American Teens Are So Sad." So if you get a chance, take a look.
Thank you. I love our community services calls. We have all these wonderful people in one room. It's just so good. With that, I'm gonna thank you, Ms. Harris. That's like Diana said, you're always giving us what we need to read. So thank you, what we need. And I'm gonna give the floor back to Mr. Daniels because I believe we are at the portion of our evening. We made it almost 2 hours. So thanks to everybody who was hanging there on Zoom in our communities. This is our presentation about the American Rescue Plan Act Recovery Fund program. And I believe, oh yes, Ms. Ayers has her hand raised, yes.
Madam Chair, I need to recuse myself for the rest of the meeting, if that is okay with you.
Absolutely. Thank you, Councilwoman Ayers, for everything this evening. You have a good
And
evening.
everyone have a wonderful night. Thank you.
Good night.
Thank you. Good night.
Night.
All right. And with that, I will hand the floor over to, I just want for the record to note that Nicole Ayers, Councilwoman Ayers, recused at 9:09. Thank you. And the chair, Chief Daniels now has the floor. Thank you, Chief.
Thank you very much. And please forgive me, my cough is coming back. So that's why I was going back off and on. And I'm still in the office. And so just forgive me if I may have to drink some water. So thank you very much, Madam Chair. So tonight, the purpose of tonight, and I provided a slide deck, is to share some background information and also to present to you tonight the recommended funded projects for the city of Norwalk's American Rescue Plan Act Community Recovery Fund recommended projects. So just level set or just bring us back to what this opportunity has afforded the city is that the American Rescue Plan was passed by US Congress back in 2021. It provided a lot of money to cities and municipalities, and Norwalk has received funding as well. In the particular act, the federal government outlines and describes eligible uses, specifically around addressing ongoing public health response costs, addressing the negative economic impacts of COVID-19, and supporting overall city operations and government service. This particular slide just gives you a snapshot of the variety of eligible uses. And I highlighted the one grants that, as I have said many occasions, that I was really excited that this particular funding opportunity allowed the city to contract nonprofits to provide services. So the city didn't have to provide the service, but we can identify what the federal government calls recipients to provide specific services. So I'm going to transition fairly quickly into our funding approach, and then at the end, share the recommended proposal. So what was our funding approach? The purpose of this program was to provide local assistance in the form of competitive grant funding for nonprofit organizations that respond to the negative economic impacts of COVID-19 and public health emergencies. That language comes specifically from the federal guidelines and the law around how and what categories municipalities can use funding. In Norwalk, our plan allowed us to allocate, and I'm planning to share the distribution of 1.5 million to create the Norwalk Community Recovery Fund program. I want to remind everyone that the federal government does give a lot of discretion of how the city can use the money, where the city can allocate the money. So these are very, very broad categories in how the city can use funding. I also want to take a moment and pause to say that, and at least to my knowledge, that this program is unique across the state, and many municipalities have looked upon us to help think through how they will distribute the funding that they receive. So what is that funding approach? So the process was applications were received through an online portal, which we were excited through the chief financial officer to help get that up and running. We did this all in real fast time. Applications were received through the online portal. My department reviewed the applications for completeness, and then they were sent to a panel review committee comprised of both city and outside independent subject matters for evaluation and recommendation with a recommendation to be funded based on the scoring rubric. So all applicants were scored. Funds will be distributed to organizations for the sole benefit of Norwalk residents. So all funding that will have been or being recommended, the sole purpose is that they have to serve Norwalk residents. And I'll talk about this later on, that they also have to document that they're serving Norwalk residents. So an organization that may be located in another community most certainly is eligible to apply if they meet other criteria, but the funds that they receive must be allocated specifically for our city. As I pointed out, the Community Recovery Fund was a highly competitive process. We received, the funding is 1.5. The total amount, if we weren't able to fund, was about $2.5 million. So we had to make some very tough decisions. Specifically, we didn't have an extra $1 million to fund all applicants. So that was a very, very tough task. So tonight, the recommended projects, as you will see later on, span our community from increasing access to mental health services, to food insecurity, to housing stability, and educational and specialized supports. They reflect both the needs and the commitment to help our citizens. So what did that application process? I would also note that most of this information can be found on our website. Our department provided 2 live informational webinars. So on January 25th and January 27th, I provide a similar slide deck, but also provided opportunity for potential applicants to share questions to help them complete their application. I'm not going to read the entire thing, but organizations have to meet general requirements, complete the outline, approved for funding will be presented, and it just lays out what the process was. ARPA includes language that may require grant receipts to meet additional financial compliance guidelines. Remember, remind everyone, these are not the city guidelines. These are federal guidelines that as a recipient of the funds, that all recipients will have to comply with. And recipients are expected to be familiar with these requirements and willing to comply with all terms. The actual book, similar to the fishing study, is quite large. It was our goal to attempt to highlight, summarize, but it is with the responsibility of the applicant to know what those requirements are. Eligible applicants will be assessed on their ability to the following. This is COVID-19 dollars. So how will your organization address COVID-19? Describe your goals, demonstrate organizational, fiscal, and program capacity. But this information was also outlined as part of the live webinars, and this particular slide deck is also available online. Outreach and site services and convenience. So this was a requirement. We wanted the services to be available and accessible. That's very important to both my department, the administration, and quite frankly, it's best practices to make sure that when services are available, we want to make sure that they're accessible. So what good is a service if people can't get to them and know about them? And then number 6, which has been mentioned several times, that we looked at applicants to provide culturally appropriate and programming that includes bilingual capacity and cultural relevant services. So this was the lens that we've asked our reviewers to look to before awarding an applicant. This slide just talks about references that we made available to encourage applicants to make sure they understand that while the contract is with the city, the oversight and regulations are from the federal government. It was also talked about equity. The regulations also advise, because it's not mandatory, but strongly advise that communities that are receiving this funding look at what is called our qualified census tracts. And as you can see, it's very clear, it was mentioned in many ways. This is a map of Norwalk and 044, 042 South Norwalk. So we were very sensitive to make sure that services that are provided, that organizations were providing in our most challenged communities. And actually, as part of the actual full slide deck, we made it clear that we're going to look upon that and look upon that favorably. It wasn't mandatory; organizations didn't have to, but it was important to us as a municipality and as guided and advised by the federal government that we should look at equity, and I think that makes sense. It's just on the slide. So as you all recall, we've identified and presented to Common Council, I don't think, maybe a year ago, I'm not even sure anymore, a long time ago, that these priorities, these funding categories were identified. I'm not going to read them, but we've talked about this before, consistent with what is eligible. To remind people that may be new, how do these priorities come about? We use our data. Teresa mentioned about our community health needs assessment. I interact with our nonprofit community on a regular basis. We also polled what is the community service providers call, which is made up of 60 to 70 providers, and then just talking through community throughout to get an understanding of what those needs are. So let's get to who's awarded. Who's awarded is in no particular order. It was just how the spreadsheet came out. Norwalk Acts. My document is real small, so I'm going to minimize myself. So Norwalk Acts, we are recommending $70,000 to fund. The expansion category is the specific line item code that we had to make sure we were in compliant so that this funding can be distributed. And I think it's important I read into record the project summary, and it's really a brief summary. The requested funds are for a position to coordinate and build Norwalk workforce development, infrastructure, and strategy to help Norwalkers get back to work. The workforce development coordinator will be working on behalf of the city of Norwalk and supported with additional funding by Norwalk Acts. So the city will put in $70,000 and Norwalk Acts will be supporting additional funding to address the sustainability beyond ARPA allocation. The Norwalk Senior Center, $20,000. Bright Minds is a behavioral health program for seniors and elderly people struggling with stressors brought on by the pandemic. It is a collaboration of 2 organizations, the Norwalk Senior Center and the Community Health Network in Norwalk, Connecticut. The Norwalk Catholic Charities of Fairfield, Connecticut, they hold offices and they are provided here in the city of Norwalk, specifically addressing counseling to marginalized, underserved immigrant community in Norwalk. This funding will be used to expand their behavioral health program to provide a second full-time bilingual clinician on board. It is important as I read these, you will see a lot of hiring expansions, but part of the plan was to clearly articulate what that sustainability plan is. I will also say that in our own deliberations internally, from my colleagues who are not familiar with the nonprofit world, this is what we do. We work with grant funding and try to leverage and match so that we can continue the programming. Norwalk Community College Fund, $7,000. Funding will be allocated to the Norwalk Community College Food Pantry, specifically to help our Norwalk students who are in secondary education at the college for their emergency pantry. The school has identified, they know who the Norwalk students are, and has developed a program that when a student from Norwalk is in need of food, this will help provide more resources in their food pantry. Norwalk Community Health Center, again, mental health. Their funding to help respond to the revenue loss throughout the pandemic has strained them. They're looking or requesting a psychiatric APRN who can provide financially sustaining telehealth services to basically expand their mental health services. In one of the slide decks, I think specifically on the portal that we created, mental health has been a need. And I know this committee has mentioned it and has come up many, many times. So that was certainly a priority we looked at very seriously and wanted to see how the city can expand the mental health services. The Housing Collective, 160,000. This particular housing need, as you all know, my office facilitated the Unite CT program, rental assistance program, and we also have the fair rent department that we oversee, and we're getting very, 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 very busy again. This is an intervention program specifically. It's a collective, but this money will be geared specifically to Norwalk to help Norwalkers either stay in home or with their eviction process, but provide those needed services to our most vulnerable, specifically who are struggling with housing. The Elder House. This is funding. Their funding will just help stabilize the Elder House operations. They are like our high acute senior services, senior support services. I don't want to mischaracterize, because my grandmother, we called it senior care, so senior daycare programming, but the funding will support them, and they asked for 25,000. The Open Door Shelter, about specifically their financial opportunity. They have been doing a great job. They are expanding, they're doing work, and this just speaks to our workforce development priority, and funding will be used to hire a second employment specialist to meet the demand for employment services. The Liberation Program, substance abuse services. Substance abuse is on the rise. We talked about suicide. People have been impacted, and the Liberation Program we're receiving ARPA funds to partially cover a salary in the Liberation Families Program, and also a counselor. Positive Directions, mental health. ARPA funding will be used to cover the cost of gender-specific support groups and the monthly social recreation activities for the prevention training and SMART groups. The facilitators' time for these will be provided as in-kind donations. We like in-kind. We also ask organizations to see what match they can do and how they can leverage these dollars, again, to help them think about what is that sustainable plan after this one-time investment to support the work to provide these critical services. The Connecticut Renaissance is another mental health program. The plan, they're requesting funding to create a full-time outreach clinician that will focus on adolescent patients who have been negatively impacted by COVID. The clinician will see patients 50% of the time, and also will conduct outreach 50% of the time. It's also important, I'll kind of give editorials because there's so much to talk about. We can talk about this all night. These are contracts. So what this also does is allow the city, whether through the different departments that we serve, to really weigh in of how those services are done, to really, when reporting or come, if we have challenges with the support, to really hold them accountable of the expectations, not just from the federal requirements, but also from our department, to ensure that these services are being done in the way that we believe they should be done, and making sure Norwalkers are being served. The Saturday Academy, they asked for $24,000. This funding will expand a mother and daughter activity program, specifically mother and daughters being engaged in engineering activities. So they asked, because of COVID, they would like to expand this program to get more people in and get people active and connected to resource. The Triangle Community Center, the funds we use to help the student population recover from the pandemic by ensuring that the LGBTQ+ students have the resources. They will be partnering in the school system and have a full-time clinician in school working with the school. Horizons at Norwalk Community College. This is a daycare. I don't know if Mary is still on because I can't see anyone anymore, but we also allocated for mental services for our young ones, and visiting and being a part of the early childhood programs. Our child care centers are reporting that their children and families are struggling as well. The young ones are not immune. They may not have the verbal language to articulate what's going on, but they most certainly can feel it. I have a 1-year-old, and I'm amazed that he'll put on a mask. I think if COVID wasn't here, he probably would not want to keep a mask on, but that becomes his new norm. The Norwalk Grassroots Tennis and Education Summer Partnership Program, $70,000. And I'm just averaging, you all see the real number just to move the conversation. Funding for the Summer Partnership Program will work to address the challenges of COVID, both created and exacerbated for the children, youth, and the families they serve at scale. They're planning to serve approximately 120 children and youth. Person to person, the critical need of food. You've heard me talk about that. This particular funding will help them expand their food outreach program, increasing days and hours, getting food both into homes of families, a delivery program. So this is expansion to expand the need of food through that program. To Human Services Council, they are the school-based center here. They're asking funding to expand, and now many of you are familiar with the Welcoming Center and provide some part-time support services under this Welcome Center one-stop shop. Stepping Stones Museum for Children, another child care program. The funding will focus on building resilience for children, similar to the other one, just provided the services and expanded services specifically to child programming and their families. Family and Children's Agency, Mental Health Services, ARPA funding will increase staff to increase and expand services and meet the need. They specifically call out working diligently to hire therapeutic service, specifically in English, Spanish, and Haitian Creole. The Norwalk domestic violence, as you can see in the blurb, they have seen because of COVID, a length of stays has tripled. We also asked for data to ask people to, talk about, what's the rationale and why. And so their length of stay has tripled, in part due to affordable housing shortage in Fairfield County, but this funding will allow to provide life-saving shelter and services to domestic violence victims. It's also important that many of the organizations that receive many different funding streams, they may have been cut, they may have been overstretched. So again, in the intent of the ARPA funding is to make a one-time investment to get them up, and hopefully that they can sustain it, which they articulated in their plan. The Carver Foundation, they've asked for $90,000, and this will create a partnership with Norwalk Community College local employers to help youth learn about experience careers firsthand through work-based learning and paid internships and the like. Norwalk Housing Authority Learning Center Foundation asked for $50,000. This funding will address the need, and this is again another expansion program for the SST program. I don't know offhand what SST stands for program, but it's to counter the impact that COVID has had on the underserved youth in the Norwalk public housing complexes. The team has constructed a program that will support children who have the least access to resources so that they can move forward in their education and eventually have the skills to go to college. And then lastly, Mid-Fairfield, another mental health. Funds will be used to preserve and enhance the delivery of comprehensive services for the outpatient clinic. Reporting. So these are the 23 organizations that we are proposing for recommendation. I'll highlight again that in no way that organizations that have applied is a negative impact, that the proposal was in any way weak. It was really about the ability to fund everyone. I would also note that many of the organizations that are receiving funding, they are not being funded in whole because we just didn't have the funding, but based on our priorities, based on the strength and the scoring and the ability from the reviewers in the panel that they can make a difference through what they're providing. And the funding, as I pointed out, these are the recommended organizations. So under the American Rescue Plan, the organizations will be required to submit financial and programmatic reports to the city of Norwalk. I think this is important. This addresses the accountability. They will have to provide a complete report, which includes description of their project, their expenses and obligations associated with the project status, their project demographic. Reports will include answers to different questions. Depending on the category, the federal government also has another list of questions in reporting that they would have to comply with based on the particular category. how many Norwalk residents have participated or been served by your program. I think also this is not only does it address equity, but also lets us know what zip codes and specifically to the census tracts, because we know it's been said already through the public comment, but also as the city's chief of community services, I'm very aware and very in tune where the gaps of services are and where those needs are. So this will call out and have the providers make sure that you are not only just providing good and quality services, but you're also providing services where we all, and I think there may be common agreement around where those services need to provide it. And then again, we're always asking, okay, now you're doing the program, how are you addressing the negative impacts of COVID-19 in our community? They could have to constantly report on what their goals are to measure success with data metrics, and they have to collect. And then the federal government is still kind of outlining what the reporting requirements are. So between now and when we go to contract, that may change, and we'll have to ensure yet again that before we go into contract, based on the federal reporting documents, that the organization can comply with the reporting. I also just want to point out that for those that are watching, it's open to the public, but I want to be very clear. I facilitate the conversation and I facilitate the agenda, but every other Friday, and there's one April 29th, the city of Norwalk, through my department, hosts what is called the Community Service Provider Network Call. I've been very pleased and I'm honored and privileged that the community providers every Friday at 8:30 in the morning get up and we talk about the needs of our community and we share information so the provider community know who's doing what. So when they have a resident there in their community, when they have a resident in their office, not only are they meeting the need as that resident has come before them, but they also know who else is providing other services, so we can ensure that when a resident comes to our door, we also can support them of getting additional services needs met. I'm also very pleased that Jasmine Principe is our office manager. So those that may be listening on phone, Jasmine email is jprincipe, PRINCIPE @Norwalk.CT. I would encourage you to say, I would like to be included in that call so you can listen and learn. And we also provide, information. I share, the city does not offer a lot of grants, so this is definitely a unique opportunity, but also information does come before the city. And I also use this as the communication tool to share with our nonprofit community different opportunities. So tonight, the action item before you tonight is to authorize the mayor, Harry W. Rowland, to execute any and all documents or amendments as may be necessary to distribute the grant funding to the nonprofit organizations allocated to the ARPA Community Recovery Fund, which is administered by the Community Services Department to respond to and address community needs due to the negative economic impact of COVID-19. So I want to thank you. I know there may be questions. I'm happy to entertain any questions that the committee may have. Thank you, Madam Chair.
Thank you, Chief Daniels. What I'll do is I'll read that so that we can get a motion on it, and then we can open up the floor for questions, conversation, discussion. So Human Services Department 1, authorize the mayor, Harry W. Rilling, to execute any and all documents or amendments as may be necessary to distribute grant funding to nonprofit organizations allocated to the ARPA Community Recovery Fund administered by the Community Services Department to respond to and address community needs due to the negative economic impacts of COVID-19 pandemic. Do I have a motion to move that? Yes, Councilwoman Smith, thank you so much. It's been moved. And now for the hands I've seen, I'm just gonna go as I see them on my screen. I'll start with Councilmember Keegan.
Thank you, Madam Chair. Last one in, first one out. There you go. This question is for Chief Daniels. Lamont, are there other funding sources for these groups that are going to get this ARPA money? Do they have other funding sources, I guess is my question.
Specific to, I'm not sure if I fully understand your question.
do they get money from other places?
Yes.
Okay.
Yes, they all do. Yeah,
Oh, they all
absolutely.
do? Okay, all right. And some of the ones that did not get funded, do we know if they also receive funding from other places?
Well, Councilman Kagan, I'll respond by saying every organization have to provide 3 years of their annual statement. So the way I'm responding is they have to show fiscal management and that they're, are for, have this, the infrastructure and so forth. So when you say, are they getting funding? I'm saying yes, by evidence of every organization have to submit 3 years of financials in order to be considered.
Okay.
So this money cannot be used to build a program in of itself.
Okay.
All right. Next on my screen, don't know if this was the right order. My apologies, was Councilmember Burnett.
Thank you, Committee Chair. Three quick points and then a question. One, I first like to commend you on the process. I think the integrity of the selection process, as you outlined it, ensured that you're following the specific guidelines set forth by the federal government, which are very stringent requirements. And to have that level of integrity in the selection process is of ultimate importance, because we don't want to go down a road of violating the requirements of the federal government, which would cause much concern. Two, in terms of sustainability, I like to thank you for pushing that narrative in terms of each of the organizations had to show some level of sustainability beyond the grant. Quite often, nonprofits receive grants, they start to develop programs, initiatives, and then the grants go away and they're left with an unanswered question: how do we sustain the good work that we've already started? So I'm happy that that was part of the narrative. And thirdly, accountability. The fact that there is a process beyond receiving the money that the nonprofits have to report in how they're spending the money, the impact of the money, who's receiving the services. I think that's the true value of receiving a grant. Not only getting the grant, but what do you do with it and how does it have an impact to the community? I do have one concern, which is the number of positions that will be formed as a result of these grants. Because even though we say you're receiving this money and you can put these positions in place, those positions become an integral part of the operations of the nonprofit. And then when the grant is gone and those positions should also go away, then what happens to the good work? So if you can touch on that point about the number of positions, or what is the recommendation to the nonprofits in terms of how do you handle these positions? Are they presented or posted in such a way that says they're grant funded, so when the grant ends, the position ends? What type of information is shared with candidates that might choose to apply? Are they fully aware that this is not a real permanent job? It might very well go away when the grant funding ends.
That's a great question, Councilman Burnett. So I'll respond it this way. So we are not engaged in how that particular organization may advertise the position. What our focus is, with this funding, how will you sustain your plan? So to your point, if the plan is to hire an individual, what will that look like after year 2? And based on the And there's a lot of different factors. Now, sustainability is one of the scoring rubrics, but it's the fiscal management of the organization, the longevity of the organization, the ability to, to be consistent in our community. So there's a lot of other different factors that were considered for many of the organizations that I shared with you tonight, where they have identified the best way to make an investment to use these funds is to hire positions. And I'll say it, and you gotta be careful what I say. And I'm very confident that the organizations that have articulated positions, that they will be able to identify the necessary resources and leverage, whether internally or externally, to maintain and continue those services. Because the point is, the need is not going to go away. I can say in my 2-year tenure, through other funding opportunities that I've been engaged in, they've risen to the occasion, and now those positions are full time. So that's the way we looked at it. As I pointed out in sharing in the nonprofit world, it's not considered a negative in terms of what happens next. This is what they do. This is how you get funding, and you find matching, and you leverage your board and development coordinator to all figure out how do we create programs to meet the needs of our community.
Just as a quick follow-up to that, so did any of the organizations selected indicate that the position would end at the end of the grant life?
No, sir. We did not consider any programs of that nature. We were, and again, this was a position that the city took. I mean, we could have, but it was very important to us that we wanted these investments to be long lasting. So how do you leverage this opportunity to build programming for your organization? Because once again, the city doesn't provide many of these critical social services.
Thank you.
Thank you.
Excellent question. Councilmember Rivelos?
You're on mute.
So Barbara was actually first with her hand raised for all of us, and we went backwards. And
So
because
sorry,
my
Barbara.
comments, it's probably
Okay.
no, I'm gonna actually let her go because my comments is probably gonna be a lot harsher. So let her go first.
Thank
All right.
you.
Well, my apologies, Barbara. Sorry, go for the floor.
Yeah, I actually have a couple questions. But first, I would like to echo Mr. Burnett's comments on the process, the professionalism and detail in which the process occurred, and the accountability that you are requiring in terms of, being accountable to federal dollars. So I do want to echo that because that is what I saw and heard in this presentation. So my first question is, one of the things I noticed is many of these awards are going to some of the organizations that have year after year big asks for the community development block grants. And I am, having been on the Economic and Community Development Committee for quite some time and going through that process, I am well aware that the need is so great. And, the funds are never enough. And it's a very, very difficult decision to decide where the funds will go. And like as you pointed out, the asks were greater than the give. So my question regarding that is, was there any consideration given to organizations who do tend to receive funds from the community development block grants?
I can't say specifically. I know we do part of their documentation of where funding comes from, but I will say that it was considered. All things were considered, but there wasn't no weight around. If you receive CDBG, you wouldn't be eligible for this. What was important in the regulation is that you can't mix and match. You can't, if you already have funding for a position, you can't double count a position to then 70,000 from ARPA, 70,000 from CDBG. The federal government does not allow that.
Okay.
So we monitored it from that perspective.
Okay, thank you. And then, just in terms of some of the public comment from the beginning of the meeting, I mean, it seemed to me what I saw is, a real sensitivity to awarding grants to our underserved population, to our Black and brown residents, our yellow residents, as was brought up. So it does seem to me that I see that, but I would like to hear you talk about that a little bit.
No, thank you. As I pointed out, the federal government advised municipalities to, as they think about the funding strategy, to look at what is called the qualified census tracts, which are our communities who are often distressed. And as pointed out, I can't remember the numbers, there's a criteria of what makes a qualified census tract, 50% poverty and so forth. So as shared, I didn't categorize in that way, but many of those organizations are in those census tracts, which is exactly what we wanted to see and which is exactly what we wanted to do. I most certainly understand that not all organizations receive funding, but also I think it's important to note that the pool that came in, I don't know what people assume, but we looked at what came in, and there may be an assumption that there was all these different types of organizations. That just wasn't the case. However, I support the process that we went through. It was difficult, as I pointed out. The allocation was 1.5. The request as is was almost $2.5 million. So that means we had to figure out how to cut $1 million. That nobody wants to be in that position. And we use the scoring rubric. We use the longevity or the fiscal management of the organization. There's a lot of other factors, and came to this particular place that at this point in time, and I have to point out, this is a federally regulated program, and we would not want to put any organization at risk. But also I have to say, Councilwoman, we wouldn't want to put the city at risk, because we are recipients allocating funding. This is not city dollars in that way. And so for many of those reasons, we had to make those difficult decisions. I'm very aware that some organizations are very disappointed. Hey, I would too. But the not being funded does not mean the organization or the proposal was bad, was weak, was not strong. It's just that giving the totality of what what we had to do. I support the 23 organizations that I'm presenting to you this evening.
Thank you.
Ms. Revolus.
Coming back to what was said earlier and watching and seeing a lot of the organizations pick, like, for example, I have dealt with Norwalk community funding, and they always talk about how much money they're trying to give away. So I'm seeing places and spaces that are already heavily funded. I'm seeing a lack of cultural connection here, and I'm trying to understand how people were picked, because for everybody who just spoke, and then if they're still on to watch that presentation, I can see how dismayed they would be. I would also have them to definitely, like that slide said, to continue to call you, 203-854-7989. I think this would also show how, when our community thinks there will be no change under a certain administration, it kind of represents it in what I just saw. I'm actually very concerned about what I just saw. There's a lot of, not to minimize the companies that are doing, but they're also they're still heavily backed and funded. This money, and particularly being part of the Black Caucus and how ARPA funds should be used, this should be towards an equitable manner. And I'm not seeing that executed in who was picked at all. I'm concerned about that and how that happened. And I understand the 3 years or whatever, but these are just big names that are going to perpetuate things that aren't really going to hit the grass level and the ground running of people who are actually working with the community and our low hanging fruit and bringing up our kids and particularly, I don't know. I'm concerned about the processes of this, about the funding that these organizations already get. Like, there is spaces and I didn't really, you could say mom and kid, this and that, but to certain things. You said an ST program, but you don't know what it is. I would go to sexuality before race. Like, I don't understand that. We're not connecting to what our community truly needs. And it's concerning. And it's a heavy disregard about what we're questioning and what we're asking. I hope our council heard the people who were speaking prior to, you know what I mean? Because these are organizations that get funded. Like, there is real space and places for people and organizations that ask, that are helping children, that are helping families, and that really do need the help. It's not for companies who get money on a normal basis anyway. You know what I mean? Like, I'm like, my mind is blown right now. In particular, I'll just use Norwalk community because I deal with them so much about how we're trying to give away money. We're trying to get kids. We're trying to give away money. Why are we giving them more money? I'm so concerned about the list that was presented right now. It's ridiculous. And I truly, truly hope that our community speaks out on this. I'm not minimizing these companies. I'm not minimizing these organizations, but I am minimizing the process and what is being looked at. And particularly, Lynn, it's my community who's being overlooked just because you said, oh, this one may help us. They haven't been. You know what I mean? Like, and I'm not minimizing anyone. I'm really not, because there is good work there. There is, but it's also very absurd that organizations who are already funded are getting heavily funded. I'm concerned about that. Like, and hearing our constituents that just spoke earlier, and I can understand why I got the calls. I was actually thrown off on why I was getting all these calls so much, and I understand it now and who was selected. Guys, like, this is not okay. We represent a community who needs the help after a pandemic, and the majority is not an equitable thing. Overlooking for one and not looking at the other is not an equitable basis. I don't understand why we think this is okay. And I need explanations. Please explain to me how this was picked, how we're overlooking so many, how we're going to people. Yes, I understand the sustainability of 3 years. I get it. But these are long-running organizations that we're still having the same problems, right? But we have people who are literally walking in, working with kids, working with people, working with families, working with communities who are not being looked at, not being heard, not being addressed, not being funded. And we literally just looked right past them. And I understand the calls now. I'm not even a part of it. I'm not a nonprofit myself. And I understand the calls now in that list that we just picked. I'm concerned. I'm concerned about how we truly care about our constituents.
Councilwoman, may I respond to your comment?
Please.
I'll respond it this way. I've already laid out and articulate the process, and I will say to you, I stand by the process. What I will also say is that this ARPA program was not designed for startups.
I'm not talking about startups.
Ma'am, please let me finish.
Okay, but I'm not talking about startups.
I'm responding to what I believe.
All right, I'm with you. I just clarified in the beginning. I understand.
But please allow me to respond.
Startups.
I can't respond if you're talking over me.
I'm with you. I'm clarifying. I'm
just clarifying. I'm just clarifying.
I'll jump in. I'll give the floor over to Chief Daniels to respond to you, Councilwoman Revoluz.
This program was not designed for startups.
I'm just clarifying. Yeah, I'm just clarifying. That's it.
One of the key also criteria looked at was the financial stability of an organization. If you look online, you will also see the additional criteria. I did not give you the whole layout of the criteria. We also looked at the funding request cannot be, and I don't have it in front of me, so please don't hold me to it, but it's definitely online. We also looked at the funding request cannot be more than 50% of an organization's budget. This funding program also If you're not aware that you had to be an organization at least 3 years in operation. So there was other criterias that we had to look at. Councilwoman, I share many of your same concerns, but again, I will say this again, ARPA was not designed in the manner. There are technical assistant grants, there are capacity building grants. ARPA was designed to look at programming to expand and to increase service array based on what the federal guidelines were. So for those reasons, and we had an independent scoring process. Some of the smaller groups, we wanted audits and we wanted financial accountability that just couldn't deliver. It doesn't put them in a bad place, but again, given the requirements that we had from the federal government and match what we also wanted to add. So all organizations were not eligible for this particular funding program. I'm not, and I hope you're not taking that we're sliding people and organizations are not worthy, but this particular program had a different set of guidelines, which would make organizations ineligible, but not from a perspective of they're not doing quality services and we need to make sure we look at those programs and how can we support them. But this particular program was not designed in that manner.
So again, I'm going to clarify that I said, I know it's not for startups in the 3 years. I said that. Again, I'm still sticking to what I just said. Okay, like for example, the cultural makeup of things that were longer than 5 years and what exactly they do. How did you look at that? Who picked this? I know what was the credibilities to it. I also know conversations that were had to, and what's brought up to me that was taught, okay, you may not be this, but organize and come together and do so on and so forth. You know what I mean? And the top of that organization is running well past 5 years. So I'm not going to let go of my point and to reiterate what I've already said, that I know, especially being a part of the Black Caucus, that I know it's longer than 3 years. So thank you again for reiterating it. I'm still concerned. And now with other things, I can talk to you offline about direct conversations, but I'm still, it's just not looking feasible for me. It's not looking equitable for me. I don't get it. Like I don't. And I hope that everybody who spoke out and others will speak up. They put their numbers up, give a call, because this is your town, this is your constituents, these are the people you hire and pay. How are we really truly helping them? Because these organizations get funded, and sometimes a new look to things can actually make it's like an old crime case. If you get new eyes to it, you can get a whole new perspective. You can break the case by getting new eyes. We might need new organizations and new eyes who are 5 years and longer, but we're not doing that. How is that possible? How do we make a change? How do we make dramatic change for our community with just giving it to the same old? How does that work?
Thanks, Ms. Regalus. I appreciate that.
I'm with you.
Oh, you're not done? Oh, okay,
No, I am. I'm over it, but I'm not.
Okay.
But
I didn't mean to cut you off there. I'm sorry.
No, you're amazing. You're amazing.
The natural.
You're amazing.
Okay.
You're amazing. You're amazing. You're good.
Oh, no, we're good.
You're amazing.
I don't know if I'll let Ms. Alterman have the floor. Thank you.
Thank you. I have 2 or maybe 3 questions. One, somebody put in the chat, who were the individuals in charge of picking the organizations? And I think he said there were a couple of people, but if somebody could answer that question, then I'll ask my personal question.
In this moment, I don't have the names of the reviewers. As I pointed out, we're city employees, and we also lent outside independent evaluators from other municipalities to be a part of the review team.
Okay, so my personal question was, is there a way, I understand that like the money there's never enough money. Is there a way that some of the organizations that got, a good percentage of the 1.5 million, is there a way to give, 10,000 of the 70,000 for the tennis program to one of the organizations that was denied any funding? My other question was, I don't know if there's been any sort of data collection on the racial makeup of the people served by the organizations that were chosen. And I think that's important.
Oh, Councilwoman, I agree with you on, but again, the program wasn't designed for us to do what was the racial makeup of an organization. Now we're talking about capacity to move this along. Also, it was very clear in the language that we need to try to move this money as quickly as possible. And remember, this was a competitive grant. So, and again, I'll say it again, denial does not mean you were bad, you were weak. It's just that we have an allocated amount of money and we funded, through a competitive process. And it was not designed, everybody apply, everybody get a little bit. And I don't think that's good financial governing around granting, because what can a $10,000 grant do? And then with the $10,000 grant, Councilman, what I think there's a misunderstanding is, with $10,000, you still have to provide all this reporting. And does the organization have the capacity to do all that? So for many of those reasons, we looked at the whole totality of the picture, and it was not designed to do what I would characterize as many grants and so forth and take from there. It just wasn't designed that way.
Sure, and I understand that, and I don't pretend to know all of the factors that went into who got one and who doesn't. But like I noticed there were a couple where it was basically like an employee and a half or 2 partial salaries of employees. And that's where I'm like, it wouldn't be devastating to that organization to get funding for 1 employee and lose a second where some other organization was given money. That's all. Thank you for answering.
All right, any more comments or questions about this motion on the floor? I realize I haven't said something yet, but putting my nonprofit professional hat on, I'm thinking about the comments at the top of the meeting, and I'm thinking about how this is a rather entrenched problem all over the country. I don't know internationally, but and certainly Norwalk's not immune, where, if you are doing a social impact startup or a more innovative, smaller nonprofit, it's often hard to find the footing to get advantage of these federal grants that you have such immense data reporting needs. So it just makes me think that, that's a need that's not being met clearly based on the public comment. How we can do that, I don't know. That's clearly not the role of the council, perhaps, but as people who are here to represent constituents, like thinking about what we can do as the city, to help amplify some of our smaller nonprofits, that don't have the infrastructure. I think that that's an important question that was raised, and so it certainly has always been on my mind. Mr. Burnett has his hand. Yes.
Yes, thank you, Chair. I guess my question my question and comment is around, this is kind of an initial step in providing the ARPA funding to a select group of nonprofits. But as a second step, there's X number of organizations that did not receive funding. So the question becomes, as a responsible city, what will be our approach to assisting those in some capacity? I don't know what capacity, but how do we address the needs, or at least begin to work with those that did not receive funding, who obviously need funding because they applied? They may not have qualified for the ARPA funding, but they still have a need. So what do we do as a committee, community service committee? What do we do as a city, as a council, et cetera, to address those? And I don't know what the number is that were denied, but to at least work with them in some capacity. And I'm not putting this on the community service department, because I know the limited capacity that they have. So this is a broader question of, what do we do to address those that were denied? Because clearly there's a need, and they have a value, and they provide a service. And I just don't think we should say, okay, this group received ARPA money, this group for whatever reason, was not approved. However, they have valid services that they provide, valuable input to the community and the growth in the community, address their needs.
Thank you, Mr. Burnett. That really dovetailed off what I was saying really well. I appreciate it. I'm seeing in the, perhaps, I don't know if we have this information, the percentage of the organizations never funded before by the city. If we do have that information, Mr. Daniels, but I assume that's not something off the top of your.
You said the question never funded by the city?
Yeah, like if there was a breakdown of who received what.
Well, I guess it's again from where I sit, it depends what you mean by funded by the city.
The city, right?
I know as Councilwoman Smith said, there are some organizations that receive CDBG funding.
Okay.
However, the city doesn't do a lot of nonprofit funding historically.
Right. That's right. Thank you, Thank you, Chief. Councilwoman Alterman, you had your hand up.
Oh, no, I was just gonna read the question that I saw in the Q&A.
Oh, there was, oh, okay.
I don't know if it's allowed, but
okay.
I do see a hand up in the attendees. I don't know if that's allowed or not at this point.
Unfortunately, we're not in public comment. Unfortunately, I just raised my own hand. No, unfortunately not. But we can receive emails at any time. So please email any of us on the committee at our city emails address, obviously available on the website of the city for sure, with any and all comment since the public comment period had ended.
Yeah, it's all right. I want to say 1-2 sentences.
Oh, of course. Yeah.
I definitely understand what Lamont was saying, that like, you know, this is federally dictated and there are certain things you have to follow, and that this money wasn't meant for taking the time to do, I don't know, data collection on who would receive it. My only point is no government ever was supposed to do something it hadn't done before. So before I vote yes or no on this, I think it's important to take a moment and say, is this something our government could actually put our own spin on and make sure we're taking the best care of everybody here? That was sort of one of my concerns. And I'm not saying whoever made these decisions for grants did not do that. I just don't know that they did do it, but that's all.
Thanks, Ms. Alterman. Any other comments, questions before we call for a vote?
I would just say the last comment I would say on a community basis is one of the places and spaces people get disenchanted about nonprofits is the fact that a lot of funding goes into operating costs and not to the people that it serves. We just saw a lot of that. I suggest that we really think about how we are serving our community, our children, our low-hanging fruit, and how we can truly develop and be anew. I understand the restrictions, but I'm telling you, I don't think we're looking at this in the best light and in the best way. And we're going to get people, not just the ones you heard, but this is, again, where I said the stigma, for example, mental health with Black people, for example, a heavy stigma with nonprofits. The majority of the money goes into operating costs and not actually to the community that they serve and help. I want you to relook at this list that we just saw and see how much of that is happening. That's all I want to say. Because we're hiring people, we're doing, I get it. But if you're going to hire someone for something that's not going to last, for example, that's an operating cost. If to clarify what I mean by operating costs for those who may not understand. And that's, again, is also one of just one of my concerns, that let's make sure funds are going to the people it's supposed to actually serve. And I wish we would have that data.
I might have frozen, but just to be, it's me. Yeah, let me turn my camera off. Hopefully everyone can hear me. Okay. Chief Daniels, I don't know if I heard the last part of Ms. Councilwoman Revoluce's point, but was that information, was there a breakdown between operating and programmatic costs in any of the applications, or?
I would have to look at it again, but what I will say is that as indicated in the reporting and as part of the requirements, part of the selection criteria was the ability for organizations to report data and specific identify the population that are serving. And I want to comment that when you look at these organizations, and I will be able to, once we aggregate the data, more than half, and I probably go even higher, but I'll be modest, that they are serving our community in different ways, and they are serving our most vulnerable, and they are serving people of color. As we look at the list, so I think it's an unfair assessment to say that with the organizations that were selected, that and many of them are in the qualified census tracts as we work to do specifically in South Norwalk. When you look at the actual list of the service array that we're providing in this one-time opportunity. Thank you.
Thank you, Chief. I'm going to continue with my camera off because my internet's unstable. I'll give the last word to Councilmember Keegan before we vote.
Yeah, thank you, Madam Chair. Councilman Burnett asked a great question. I'm not sure it was answered yet. What are we going to do for the groups that were not going to be funded? Is there anything that we can do? Because I'd like to be able to do something for all of these nonprofits, at least offer some assistance in how they might become more attractive as, in the future, to get grants. Can we help them with grant writing? I don't know, but I don't know if Greg's question was actually answered. And I'd like to know if there's anything we can do, because it's a great question. Thank you.
One thing I thought of, just to, I don't know what the possibilities might be, but perhaps reaching out to our state delegation. We're talking about federal funds tonight, but the state has funds that are available, and that we hear about awards here and awards there. Perhaps reaching out to our state delegation, which is very strong in Hartford, for some help, perhaps. It's the only thing I can think of off the top of my head.
That's a great point. Hopefully y'all can hear me. I know that we might, that's a great point, because I think talking to a member of our delegation like a couple weeks ago, there's some state nonprofit funding that may be kind of part of what they're thinking about. So hearing from our state, hearing from people, our state delegation may be able to really know that there's a massive push for this here in Norwalk. That could be, I think, important. That's a fantastic idea, Councilwoman Smith.
I don't know, it's just a thought. It's just a thought.
Yeah. So how do the smaller organizations and the social impact startups get that support? And if there's going to be technical assistance they can provide, things like that. These are important questions we need to answer. Absolutely.
If we're talking about startups, I don't know if maybe economic and community development might be able to, guide someone in a certain direction.
That's right. So certainly the conversation begins, it's not ending tonight with this vote. So I think, since I don't want to stop conversation, but since it's 10:15, I want to be mindful to call for the vote if people are ready on the committee to vote. Any questions or comments remaining? All right, then I'll call for the vote for the motion put on the table. All in favor, raise your hand or signify saying yes. And then any noes? 3 noes. Any abstentions? All right, so we're at a split vote. So I don't know what that means. I assume that means it does not move forward. And we will have to revisit this vote at a subsequent meeting. Am I correct in thinking that, Mr. Daniels? Chief Daniels? Oh, you're on mute. My apologies. You're on mute.
That is my understanding at this point.
That is my understanding as well. All right. So with that,
Can I ask one question? I'm sorry, I don't know if this is even possible. Is it possible to request like a special meeting, however many days from now, with some of the data that was requested to do another vote?
my impression is that this is timely because it's ARPA funding. I don't know what we do now.
And also, I will also say that if we don't use it, we have to return it. This doesn't like get absorbed in our budget.
No, I understood it was time sensitive. That's why I'm like, can you call a special meeting in however many days would be needed for a lot of the questions that were asked, for people to give answers to those questions so we can vote on it and not lose it.
I think it's also important that the process already been made forward, the applicants already put forth. We did not, I don't know if that's appropriate, or I don't know if that's the right word, to then say, oh, we need additional information. We are following a standard best practice. We are actually following a process that we've used several times. And so I'm just not sure if we can, and it's appropriate to ask for more information that that an organization wouldn't normally in this process. Anna, you may have some experiences in this as well, if it's okay, Madam Chair.
Yeah,
Of course.
if it's okay. So, it's timely, and I 100% will say I am the new person at the table. So I hear the nonprofit heart. I've been on the other side of these grants, and I absolutely understand what it takes, both from a grassroots position and from a well-established agency, because I've had the privilege to be a part of both. And what I will say is that we don't always, we have the understanding now of what we're looking for as a community. And so sometimes it's about seeing what's the step that we can take now and what's the step that we want to take next time. So if we're worried that these organizations aren't meeting the needs of the community, let's look at the metrics. Let's look at what we can ask for in that data reporting, so that the community can feel comfortable that the money went where it needed to go, and then be reflective about it. I'm going to agree with Lamond on this one. We've already requested what we needed to request. And if after this process, we've decided that for the community of Norwalk, for the city of Norwalk, this is not enough. All future grants, we're going to require X metric or X percentage or X, whatever it may be. But we wouldn't necessarily be able to do that this time around because we're too far down that process. But I would be more than willing to look with Lamond and with other people and the scoring committee to see if there was any other way, or if there was any unintentional consequences along the way that created a system where we weren't elevating companies. I don't think so, because I did get the opportunity to go through it with Lamond, and sometimes it really does boil down to having the infrastructure. And so I definitely hear the concern that you're seeing a lot of big names, and we're talking about the burden of administration and operation costs and people, and where is the money really going? And one of my favorite things is figuring out a way to show and a way to really dig into where is the dollar going. But we have to have a balance, and this isn't, I'm trying to figure out a concise way to put it, but I want the group to look at it and say, what is it that we can actually do right now, this moment? Because it's not always going to be possible to take that step back to perfect the process in this particular ARPA funding opportunity without also risking the money that we know we had. And so just taking that under consideration, the different various viewpoints and what we can do.
So my question then, thank you, Director.
Thank you, Anna.
My question then is, oh, and Chief, did you want to respond?
No, I was just saying thank you for that.
Oh, yes, thank you for that. So my question now procedurally is, if we adjourn right now, we're going to be in a situation where I don't know the timeline for these grants. I don't know if Norwalk stands to lose if the nonprofits of Norwalk stand to lose, the whole package, frankly, so what the timeline would be for that. And I hear that the idea of a special meeting has been floated. So what that specifically would be for the purpose of that would be something that I would want to clarify. But I see hands from Councilmember Burnett and then Councilmember Keegan and then Councilmember Revolus. Yes.
Yeah, I'm Diana, what do you? I guess my question and comment is, at this point, now that there's a tie vote, what information is needed to, what variables need to change in order for members of the committee to be more comfortable about their vote? And specifically, I'll direct this towards those that voted against it in terms of, is it the process that is of concern? Is it the organizations that were selected of concern? What information between now and whenever is needed in order to get into a better position to make a vote to move this forward? I don't think we've touched on that. What will make a difference between now and, let's say, a special meeting 2 days from now? If we don't identify what additional information is needed in order to move this initiative forward.
I'll just say quick, I don't mean to skip over Tom. I think for me, I'm sorry, I forgot which person asked the question in the chat, but like, who was responsible for making these decisions? That is not a question that you have to go to these organizations to retrieve. That is something I think probably pretty simple to look up. Maybe not right now, it's already 10:30, but like by tomorrow you could look it up. Somebody asked a question, again, I apologize, I don't remember what it was, but Lamont said I don't have that right in front of me, but I could get it. There were a few questions that was, the feeling I get from a lot of residents that I hear from and that I just know personally is Norwalk government just makes decisions and doesn't ask anybody's input and doesn't spend a lot of time thinking about it. My job is to go, I need somebody to show me they're thinking about it. I'm not saying you're not, but I need somebody to make a purposeful sort of loud statement saying, I hear what people were saying. Maybe we just go back and reevaluate and make sure there wasn't $10,000 that could be moved to somebody that got a no. I have no idea about those specifics, but I think it's worth whoever figures out if we can do a special meeting. Those are the kind of things that, like, I think that if I got basic data, I'm sure I would be able to be convinced to say yes.
So, Madam Chair, I don't know if it's appropriate. I'm on my computer. I can look it up to say who was the selection committee, if that's going to help move this along. I don't know. You tell me.
I think that would be in direct response to Councilwoman Alterman, so that information would be helpful. Yes, thank you very much, Chief.
So I'm prepared to do that now.
Please do, because we are allowed to vote again. We are allowed for a
yes, we are. That is right.
So I'll just say the whole team. So under eviction project, oh, my mouth is really dry. Under eviction prevention, Bill Mooney, Anyela Finion, and Kyle Bader from the Health Department. Homeless Interventions, Anyela, Darlene Hoffler. Behavioral Health, David Walinichek. Youth Services, Tamara Trzaskowski. Town of Stratford, Deanna Diamore, our Health Director. Early Child Care, Mary Oster, who you all know, Therese Argandesi, Donna Arcuri from Stanford, and Danique Lewis from Norwalk Acts. Workforce Development, Sabrina Church. Economic Development, Megan Fowler, Project Director. Myself, I served on that one. Youth Prevention, Darlene Young, David Walinichek, and Gavin Goodman from the town of Westport. I can also pull up the score and rubric if you would like to see it. one moment because I'm on my. Bear with me. Name of things, a lot of things.
If it's okay, while you are looking for that, I had one question on the
Wait,
slideshow.
Ms. Alterman, I just want to respect the queue, though. We have
Oh,
Mr.
sure.
Revolus, but if that is, if it's related to your earlier question, then.
It's just so one of the blocks said this will affect 120 Norwalk students or families, but I didn't see any others with that data. So how come that one had that data? That was it. But he can answer it at any point.
Sure, I can answer that. That was a blurb, but they all had to talk about what numbers. That is part of the requirement. So I really just took a blurb to try to put something in for the purpose of this conversation, and that was in that immediate part. So it was a cut and paste.
Okay, thanks, Chief Daniels. And when you're ready to put up the rubric, that would be great. And then we'll return to the queue with Councilmember Keegan and then Revolus.
I'm ready when you are.
Oh, go for it. Yep.
Okay, so this is on Word, so I know it looks different as versus from a presentation. So I hope you all can see it. Can you see that? I know there's something I can make it big. I just don't know all the little different things.
We can see.
Can you see it?
Yeah, about 2/3 of the page. Yes, yes.
I think if I put, no, give me one moment. So what I'll do is score up. So this was a scoring rubric that, and it was a scoring rubric that we looked at from other municipalities. This was not created in-house. This was a scoring group that was widely used in other municipalities specifically for this project. So here's the scoring definitions that the scores had to do: need, focus, fiscal sustainability, evaluation, priority. They all had general comments in support, and which we wanted to know. And these were the questions: need, how well has the applicant identified the need for funding? How well does the applicant score? It was a weighted score up to 20 points, as you can see. Focus, 4, 5, and 6. Reviewer comments, then with the score. Fiscal, has the applicant identified a plan to sustain activity after the grant period? Funds that can leverage the ARPA funds, meaning matching. So if we gave you 40, you can find another 50, that's one example. To what degree does the proposal have support from community organizations, partnerships? Evaluation, does the applicant provide clearly measurable goals, performance? The applicant provide a plan to use data to make decisions? The applicant serves vulnerable residents in the qualified, and we scored that high in the district, specifically South Norwalk, which is the majority of our census tract. Some innovation, how well does applicant support innovative, locally driven solutions? And then there was a score. Then there was a deliberation process, and then each panel had to agree with what the final score would be. So everyone scored individually, and then the panel deliberated to submit a final score. That was then submitted, and then we looked at the fiscal management based on of the documentation, requirements, the sustainability, the infrastructure, and really the ability to manage a federally funded program. And for those reasons, we received 1.5, 2.5 came in. We had to make that tough decision to $1 million we did not have, which is significant, and had to make those tough decisions. And we landed with these proposals right here.
Thank you for sharing that, Chief Daniels. I'm trying to recall if there was it was actually Mr. Burnett was asking for those that voted no, but I see that the hands are up. So Ms. Alterman, have any responses, or should I are you?
Just on the rubric, so I saw that it said priority was 10%. Do you dictate that, or did that come with the federal?
No, that was just a scoring rubric that we felt that it was a good tool to use. So it wasn't, we didn't dictate it. It was a tool that was already developed.
No, I mean, my question would be, why is priority lower than innovation?
I have to look at it again. It was just the way that we scored it.
That's fine. I'm done now, though. Thank you.
Yeah. Well, I think I want to comment. Innovation, got to be careful again. This was not a pilot to try out a new program. Because again, it's a fairly funded, so innovation, not necessarily innovation around something brand new, but innovation, I think to Councilwoman Relos's point, are they really being creative around how are families gonna connect to your services? What does that look like? Or we're gonna use other places as opposed to our home base location and so forth.
Great. Councilmember Keegan and then Revolus.
Yeah, hi, thanks. I think I'm speaking only for myself. I'm not so sure I liked the process of how this went down. A group of citizens, some of whom I know, some of whom I don't, were able to select, who would be getting this grant funding. And then I'm supposed to either approve or not approve a decision they make without being able to even ask them questions. But I think Councilman Burnett still brings up the most important question for why I voted against this is, what are we going to do? And Chief Daniels, you said it, I got the heart of, the nonprofit, deep in my own soul. And so I want to know, what are we going to do for those that didn't get funded? Because I think that there are probably a number of groups that maybe should be considered for additional funding. I know our colleague Barbara Smith said, we can go to the state. We have maybe some cannabis money coming in. And I will say this, if you can assure me that we're going to do everything we can for these other groups, then I would consider changing my vote. But I just think in the future, we need to address the concerns of Councilwoman Revolute that, we at times fund the same people over and over and over again. That's why I asked Lamont what if they receive funding to begin with. Sorry about that. But in any event, I would consider my vote if we choose to vote again, if I can get some assurances that we will look in the future to helping these other groups somehow get funding that they desperately need to do the good things that they want to do too. Thanks.
I don't know if you're directing it at me, but I think, Etta Vivian, which I'm really excited that she's here. Those that have public comment, it's not going to go unnoticed. I think that's something, Councilman Keegan, that we have to just figure that out. As you all know, I'm always talking about, I want to do a lot, but I'm going to need resources and capacity. This is a new, my department is new. And I'm really happy we were able to support funding for Human Services Director to bring on some support, but we may still need to look at what does that look like to be responsive to a variety of needs. So yes, we can figure that out. We most certainly can figure that out. And we most certainly can look at what role can we play to support our smaller nonprofits to get them in a position to be applying and be in a position to be in this position, especially with highly regulated program funding requirements. So we can do that.
Thank you, Chief, for that. I know that means a lot to the smaller nonprofits, just generally. Is your hand still up, Councilmember? Do you have a follow-up to that, or? Oh, no. Yeah, you're good? Okay.
Yeah, and I'm not going to speak out of turn when I'm just really struggling with this whole situation. Would we be better off possibly tabling this? I mean, is that something that we can do and maybe vote on it next month? Would that be something we should consider? I mean, I'm not making that motion. I'm just asking my colleagues if we think that that might be something we should consider. Just curious.
Yeah, that's a very good question, Mr. Keegan. I'm thinking back to what Mr. Burnett said and like what would change between now and then. Is there any information people would need? I have some thoughts, but maybe I'll let some of my colleagues speak before I say my piece. But
sorry, Lamond, I don't want to speak out of turn, and of course you're my boss here. So I think as a group, maybe we can, like I mentioned, for forward thinking, right? In this process, we're in the midpoint, closer to the end, but being forward thinking, if there's a group that wants to get together and really look at what does the scoring rubric should look like for, a community impacts grant versus a highly regulated federal grant versus a health, like look at all those differentials and say, this is how we would like to approach it in the future. Just having like a task force almost, that's something that's probably within this council's ability. And because it is for the smaller nonprofits or the ones that aren't as prepared to take on a highly regulated program, it's about the business aspects of it. So you might want to bring in other groups to talk about those pieces. It's the budgeting, it's the staffing, it's the equipment, it's the space, it's the partnerships. So there's a lot of development that goes into it. So I wonder if, the question that Mr. Burnett brought up, that Mr. Keegan brought up, that there should be like a task force that really looks at what are the different pieces that throughout the year we need to look at in order to better prepare or have a more equity lens associated with it, or prioritize certain things for the Norwalk community, if that makes any sense.
I'll jump in. Most definitely, to me, I mean, it sounds like a writing initiative or task force could be something that we as a committee commit to, knowing this conversation tonight. I see you unmuted, Chief Daniels, and then I'll get back to our queue. Thank you, Director Estrella.
Yeah, I guess, to respond to Councilman Keegan, I guess I would just caution the committee to table it. These committees, these organizations put forth their best. We went through a process and they need to serve residents, and to prolong this will then prevent them ability to serve. And again, yes, there are some larger organizations, but they're not all large. I don't know what the impact would be, because I think we have to hold true to that part of what at least we submitted from our department, that we would go through this process, and then April and then May, we would hope that we can start the contractual so the money can get out, so they can do what they need to do to expand, increase, to meet the needs that we've identified as priorities. So I just would caution to table, giving that we're moving forward, and these organizations are the ones that were selected, and I think they're all great organizations, given the process, and those that were submitted should be granted from this process. I was just cautioning us to table it.
I see the need, to your point, of all the Norwalkers that will be served by the organizations as presented, and what would happen if we threw this all out and had to start again. That would have implications for service provision in the city, I think, and that was what I'm understanding. Yeah, Councilwoman Revolus. we can't hear you. Unfortunately, your audio. Okay. I'm gonna, in the interest of time, I'll get back to you when you can get online. That sounds good. So yes, Councilwoman Smith.
Yeah, thank you, Chair Johnson. I wonder if as a committee, we together can make a commitment to, highlight some of these smaller nonprofits and make some kind of a commitment to, move their initiatives forward. I'm not really sure how, but somehow we can do this. I have a lot of concerns about losing this money. Mr. Daniels has made it clear that there is the potential to lose it if we let this go on too long and have to do the application all over again. And to see this many people who are in so much need lose that, I really hate to see that. So I want to put that out, how important I think it is that we take another vote, because it's too much money to lose. And then we as a committee, going back to what Anna Vivian had said, maybe a task force, but as a committee, maybe we can make a commitment.
Absolutely. I agree with you 100%. Barbara, Councilwoman Smith on that. And I, as chair, would commit to doing that right now.
Can I just ask the timeline? When, like Lamont said.
If I could, Ms. Alterman, if I just could finish my sentence and then we've got a queue going. Thank you. But I feel like for me, I'm willing absolutely to commit to that right now, where we can talk about, even if people want to get into some nuts and bolts and we get some experts to come with a specific eye toward the smaller and the social impact nonprofit space, for sure. Councilwoman Ray-Lewis has been very patient now that she has audio, but Ms. Alterman, you were interjecting for something related to that, or?
I just wanted to know the timeline. Like, I've heard many pressure tactics of we're going to lose the money, so we have to say yes tonight, not to.
Okay, I'll put it in that question and I'll get back to you in the queue. So I'll get back to the queue and then you'll be after Councilwoman Ray-Lewis. Thanks. You're on audio now, hopefully.
Can you hear me now?
We've got you. Yeah.
Perfect. I'm for tabling it. But that being said, a big part of the people we should be asking, and a lot of the things that were brought up that we could do should have been done prior. A lot of our questions are coming from our community and we're not looking at them. I'm not even usually a person to do that, but look at the Q&A, right? And you're asking what can help. But one of the first questions was, how did the committee commits to the list of checking the impacts of biases to this? And that's something that this town does all the time. Like it's shown quite clear that there's bias here. We have 8 questions right here from our community that maybe could even help us, who we should be talking to in the first place. I really think we should be tabling this, but that's a very important question that was asked. How would the council address concerns that the list of the organization suggested that implicate bias impact the selection process, other than citing the use of the rubric? That's the first question. There's several more, but we're overlooking even questions that may or may not change other people's mind. But I think what we should do, and what can be implied, especially to the people who have been here, lived here, worked here for a minute, nobody from Westport or anything, or just got here, no disrespect, but they're asking it right now. And I think we should address it. And I'm not even usually like that, to be honest with you, but there's good questions here. I also think it's a great idea to table it. We shouldn't get rushed into something that we don't feel is right, period. And I don't think that's right of a council. If 3 of us said no right now, 3 of us said yes, how do we get the information and questions that we brought up to show me that you will actually do this for other organizations before I say yes to you? Because I'm not changing my vote. You guys I might get voted out, whatever, but there's great questions right here that maybe we should ask and answer. And as chair, I don't know if I should be doing it, but that's why I kind of asked you, do you mind looking at the QA? Because, I don't know if I'm supposed to be doing that or whatever. I don't really ever do that, but there's great questions here that implies or may change minds, may not, I don't know. But that's the bias part in Norwalk. Come on, man. How do we address that?
Thank you, Councilwoman Revolution. Well, we're still in like a hybrid world. This is,
Yeah,
to have the
it's
Q&A
crazy, right?
is
I
difficult
don't
because
usually
I'm
look
not
at that, but
able to
yeah.
see it while we go. So what I'd like to do is just make sure that before we end the Zoom, and I'm speaking to the IT folks now, and I appreciate you so much, just to maybe make sure that I can copy paste these comments so that we don't lose them.
Please, yes.
And then at that point, what we can't like have like the public comments over, but I want to make sure we don't lose these comments, to your point.
Right.
Yeah, so
they're good questions. They're very good questions that may help right or left, you know, it may help. It may move some who think that they should, may move some that think that it shouldn't. But there's really, not for nothing, there's really great questions in our Q&A right now. That's all.
I would recommend copying it before the meeting ends, because I'm not sure if you can recover when it's over.
Okay. Thank you. Yeah, I'll need maybe 2 minutes before we before we sign off. So perhaps if we could have 2 minutes after we adjourn, I'd appreciate that. I appreciate that. Sure. Thank you. Thank you, Councilwoman Revolution. Yes, Councilman Alterman.
I copied it. I put it in a Word document, which I can email. You just like, select it and copy it. So my question was just, when is the deadline to like that we lose the money? What has to happen by what date, or we get no money?
I don't have that before me, Councilwoman, but I want to remind the committee, and also I think the larger Common Council, we may have to pull the record, that when we initially reported of the plan to distribute the ARPA allocation, I also presented my part. I also shared at Common Council that we will be doing this external evaluator process. And so if the Common Council approved the process maybe a year ago, I think we probably need to look at that because this is also a new committee as well. Way back when, I'd have no idea where the dates are. I mean, but I'm sure we can find those when we presented the entire strategy. And I know I was a part of that because I presented the community service piece of what we were going to do. And you all approved the process and the different things that how we were going to move forward. So I just wanted to point that out in order to add to the discussion specific to the recommendation is to hold back and move and not do it, because this would start the whole process all over again. This was almost a year in the making of getting the documentation, studying the guidelines and moving forward. This is not a monthly, it was in November of last year, November of 2021 that we presented to the Common Council. So I just think that's important, Madam Chair, that for those that were on the committee and council, this process was approved.
That is a very important point to note. Thank you. And also, oh, I'm losing my voice now. Excuse me. This is to point out that we're in a fiduciary way, like authorizing the mayor to enter into contracts, which is really what we're voting on. But I understand that we are seen as an accountability mechanism as well. And my concern is that we just don't know, the deadline. I don't ever want anyone to feel like they're rushing into a decision, but to your point, this has been in the making since the beginning of, this council term. So, the community services piece of this has always kind of been to give this committee like an accountability stance, but at the same time knowing that the scope of this is just to authorize the mayor. So I'm kind of struggling right now in terms of that, because that's literally to kind of center us back to what we're voting on. And we don't know like the timeline to your answer, Ms. Alterman. Like if Chief Daniels doesn't know, then this is information that, again, if that's important to you, we can try to get that. But I'm trying to think.
Yeah, I mean, that is important to me, but I find it strange that nobody knows. I mean, because one of the reasons that organizations were selected versus not selected was the intricacies of dealing with a federally mandated grant. So I assume the city at least knows deadlines for.
I can, but Councilwoman, I don't know that by heart, but if you allow me to go back on my computer again, I can most certainly go back on my computer.
And somebody
go back on my computer.
Okay. And just to be clear, like the process as it sounded to me is something that every federal grant making endeavor that I've been involved with goes through a process similar to this. So when I'm hearing the names of the folks being listed, and then I'm seeing, accusations of implicit bias, that's very serious, but I'm also concerned because a lot of these folks that have been listed, I don't want them, we're kind of venturing into that territory, right? Where I don't want to accuse people of being, having implicit bias if, this is, I think I just want to say that, we need to be mindful of that fact too, that these are people who, a lot of them work for the city, a lot of them we know, this is, so yeah, Councilwoman Smith.
Just thank you so much for saying that, Dominique, because, those names that you listed off, Lamont, these are our community leaders who we have counted on and depended on to look at inequities, and those are names that we largely know and largely trust. And that is a concern. So thank you for bringing that up.
Should I think it's time now to call for another vote, unless other folks have other comments or questions or things they would like to ask to inform their vote. No, not seeing any. All right, well, I'll call for another vote on this. So should I read the motion again, or I'll read it again, just so we're reminded. Authorize the mayor, Harry W. Rilling, to execute any and all documents or amendments as may be necessary to distribute grant funding to nonprofit organizations allocated to the ARPA Community Recovery Fund, administered by the Community Services Department, to respond to and address community needs due to the negative economic impacts of COVID-19 pandemic. So all in favor of that as it was put on the floor by Councilwoman Smith, raise your hand or say aye or yes. All voting no. And abstentions are none. So that is again a split vote, 3-3. So the motion does not pass. So we are where we were. So at this point, since we are where we were, I see a hand up. So Councilmember Burnett, you can have the floor.
Yes, yes, Madam Chair. So again, I raised the question as to, we voted twice. We've had a stalemate twice. What information is needed? If we were to end the meeting now, or someone puts forth a motion to table, the question would be, table this decision till when? So we would have to identify a specific date. And then what information would be needed? And I'm going to lean towards those that voted against it. Let's be clear, what information, what changes in the current information that has been shared is needed in order to satisfy or create an environment for a positive vote. If we leave here tonight without having some idea of what that information is, then when we come back together to vote, we're going to have a split vote again. So it's important to identify what are the outstanding factors right now that need to be addressed between now and the next time we come together and vote. And we have, and I know Council Member Keegan has shared some thoughts, but those I'll specifically ask Council Member Altman and Council Member Revolus, what specific information would you like to see or obtain between now and the next time we come together, so that you can have a clearer line of thought when we vote?
For myself, I would think A, like we said, clarifying the process. B, the actual movements of what we would do for companies that weren't. C, all these questions that are being asked of us right now in the Q&A answers for, you know what I'm saying? And again, in correcting or understanding, in particularly with implicit biases to things, I want to make sure that's not clear because obviously our community feels this way. Right. So, and again, we can make sure our small communities, our small organization are seen. So what would that look like? Put something together for me to see that, you know what I mean? Answer the questions that the community is asking. These are organizations that literally have paid people for grant writing that gets grants all the time. Like, how are we making a true different change? How is this going to impact my constituents, our community, Norwalk? You understand? And what was asked, and to say, oh, we can do it. Show me plans of how you could do it.
Greg's point would be mine exactly too. At this point, given that this is, we are, elected officials, we're here to represent people, and we're also here to work together and find solutions and try to collaborate and compromise. So given that, where's the ability to find a way forward where we can address the concerns that the no votes have? Yes, Mr. Burnett.
So with that, I will make a motion to table this vote to the specific date of May 11th, 2022, which is a Wednesday, the second Wednesday in the month of May, for the specific business of voting on the approval of the defined nonprofits to receive ARPA funding.
For clarification, Councilman Burnett, is that on the general council meeting on the 11th, or is that you wanted to come back to this committee?
This is a motion to table for a special meeting of the Community Services Committee.
Okay.
On Wednesday, May 11th, for the sole purpose of voting on the approval of the nonprofit organizations that have been presented to receive the ARPA funding.
Okay. I guess my question is that a date everybody can make? We don't know.
Make it if it's early, but are we sure that May 11th, right, is not past the deadline? That's all. Since I still don't have an answer to that question, are we sure May 11th is not too late?
Too late for what?
For losing the money. I mean, you guys have said many times, like if we don't do it in a hurry, we'll lose the money.
No, that's not a fair characterization. When we talk about losing the money, we're talking about through the federal regulations. They're asking municipalities that once received to move the money as quickly as possible. You all are aware that we received the first cycle, and in the second cycle, if I'm not mistaken, I don't want to speak out of turn, is coming probably in October. So if we do prolong it, we would just have to, we would probably just have to look at doing something one. I think when I talk about moving this along, is that we started this process in November to articulate what the goals are, what the priorities are, working with constituents throughout the community, and to move this deadline, because we part of the meeting was to part of the deadline that was created was to also present at this meeting. You all take it to the Common Council, whatever, the next meeting. But again, this started in November of 2021. So that's what I'm referencing, the deadline. I believe if we don't use the ARPA money that we receive from the city totally by 2024, the money must be returned.
Okay, so thank you for answering that. That's quite a for our date. So I'm in agreement with Mr. Burnett saying May 11th to revisit this issue.
The second, the third.
Okay, so there's a motion on the floor, so we can call a vote on it. All right, all in favor of the motion to hold a special meeting on May 11th? Oh, no.
I'm just looking, second Wednesday of the month is Recreation and Parks.
Oh, never mind. Okay. Yeah, everyone check your schedule. No, it's all good. So the motion, I would say, do we still have to vote on it, even though there's a
What time is the recreation and parks meeting?
7. If we can do 6, but that gives us 1 hour.
Calendar.
Why don't we call the meeting at 6 o'clock?
6 o'clock? Okay.
Check my
Special
calendar.
meeting, everyone check their calendars.
Yeah, I mean, that's 2 weeks from now, right? I think any of us that have questions.
It's actually 3 weeks from now.
Oh, sorry, 3. I certainly, my questions I don't think are that hard. I can put them in an email and they will have 2 to 3 weeks to answer them if they think it's appropriate for them to answer. But I don't think that's asking for too much.
Okay, so that means that do we need to amend, we'll amend the motion, Councilmember Burnett, for a 6 p.m. meeting?
I didn't give a
You did?
specific date. I set specific time. I just said May 11th.
Great, then we don't even need to amend it. Thank
No,
you.
we don't.
All right, well then I'll think we'll call for a vote on that. All in favor of Mr. Burnett's motion? Okay, I think that's unanimous, but I'll still call for a no. I'll call for an abstention.
I do have a clarifying question, Madam Chair, at least from a department's perspective.
Of course.
And I think I recognize the motion that Councilman Burnett provided, but what I'm still not clear on is it that you all will provide these questions. I'm sorry, I had to take a Halls just to moisturize my throat. That you will provide the question, because I'm not following the chat, trying to pay attention to what's being discussed and trying to write a little bit. That you all will provide the question. So I guess is it going back to Greg Burnett? What's going to move this? Is it you all providing the questions, we provide responses, and then there's a vote? But then I guess my question is, so if you're not satisfied where we are, I think from my again, these organizations took time, and I think we're making assumptions who has a development coordinator or not. There's a lot of assumptions being said because not all of them are large organizations. That they went through this process. We prolong it. What happens next? Many of these organizations are waiting for a decision so they can determine what their next steps are from their own fiduciary responsibilities. And some of them are not large, and some of them are small, and some of them are noted that we shared. So so we then can clarify with them. I just don't know what to tell them, I guess is my question.
That's a good point of clarification, because now that we've stated publicly that these were the folks that were chosen, they may be in some limbo is what I'm hearing. So they've maybe hopefully budgeted in certain ways anticipatorily, but maybe not. What do we tell them? That's a good point. Mr. Burnett.
Yeah, I think, our discussion is at the committee level right now. It still requires the full common council approval. So even though it has been publicly shared, it's not ratified until the full council meeting. So we're just delaying this, as opposed to if we were to approve it tonight, it would go before the council, the next council meeting next week. So by having the meeting on May 11th, it will be on the council floor, if approved, on, I believe it's May 24th. So I don't see an issue with the 3-week delay, even though it's been publicly shared. Those organizations whose names have been mentioned tonight will be on hold, and they would still be on hold if we approved it tonight until the full council ratified it. So I don't see any issue with the slight delay until we as a committee can come to agreement on moving forward.
Well, I think I'll refer them to the YouTube sites because you articulated very nicely.
Yes, we'll timestamp Councilman Burnett's response there for them. Thank you. Just as a double check before we adjourn then, to make sure that Chief Daniels has what he needs. I see a hand up from Councilwoman Revelous. I just want to make sure everyone is available at the time we're discussing. Oh, she's not. Okay. Oh, that's where your hand was raised, I bet. Okay, got it. So if 6 p.m. it doesn't work, should we set another time now, or is this something we do offline? Because now that we've set a special meeting, I presume we have to follow through. So we should probably work that time out now while we're all here. It's really
Would the 18th be too far?
Well, Matt, if I can just comment, Madam Chair, it is almost 10 after.
I know it is. Yeah.
We have time to decide. We can meet at 12 noon. We can meet at 3 o'clock.
Alrighty.
We can meet at any time. The specific date was May 11th.
Got
we
it.
do not have to go through calendars right now to try to get a consensus.
Very good.
We have time to make that happen.
Very good.
People can move things around because this is a priority item to be available for the meeting on May 11th. So let's not do that right now.
Very good. Thank you for the time check. I just saw that. Thank you. I got in the zone for facilitation. So what we will do is we will meet on the 11th, but it is time TBD offline. Yes, Councilman Revelous.
Just a question. It doesn't have to be, because some of us actually have things that can't be moved around. So just wondering, would the 18th be too far? Just wondering. We don't have to, but I'm just asking. But there are, in particularly being pregnant, there's some things you can't move around. So just wondering.
Well, I believe we already voted for the 11th. Am I right? So
I'm just okay. So if it's not that, but I was just wondering if that's a possibility. That's all.
Okay. Yeah, unfortunately, we already voted for the 11th. So, but we will work together to figure out a time on that day.
Okay.
Okay, very good. All right, and with that, thank you for those folks. I think we got all 10 of the Q&As. So for those folks that that was important, we have to make sure we have all those for answering. Just checking on that. I think that's a thumbs up. So for those
Sorry,
folks.
I have all the questions and I will email it as soon as we're
Great.
logged.
Okay, very good. So then we are free to adjourn. May I have a motion to adjourn this evening?
Motion to adjourn. And I also sent you a picture of all the questions right now. It's in your text.
Oh, excellent. Okay, I'll check that out. And thank you for that to Chief Daniels, to appreciate it. Barbara, your hand was up, but Diana, I heard you. So the motion to adjourn, all in favor?
Late.
Mr. Keegan, all right, we are all in favor to adjourn. Good night, all, and we will see you on the 11th. Thank you all very much.
Thank you.
Night.